We are so lucky to live in Mendocino County.
The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
ये bet में आया.
我们能够做到.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste. આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
या ये है all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders. For ourselves. For you. For us.
For our community.
Por nuestra comunidad.
Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who...
Can you conduct the roll call?
Sure thing. Supervisor McGorty?
Here.
Supervisor Mulhern?
Here.
Supervisor Hashak?
Here.
Chair Jurdy? And Supervisor Williams?
Here. Okay, I'd like to ask someone in the chambers to lead us in the pledge.
I pledge allegiance. United States of America, the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you. Next, we have the public expression on items not on today's agenda. Do we have any members of the public who wish to comment on items not on today's agenda or on the closed session items or on consent?
Yes, we do.
First on the line is Beth Pine, followed by Jude Thillman and Ron Edwards.
Beth, you can begin whenever you're ready.
Thank you. Hi, my name is Beth Pine. I'd like to begin by reading to you a letter that I wrote to Ms. Nevedal, the director of the Cannabis program in Mendocino County. It says, hello, Ms. Nevedal. I was informed by Trent Taylor that your department and code enforcement conducted a joint visit to the cultivation site at 15183 Mitchell Creek Drive recently. I want to thank you for responding to my complaint and those of us that live in close proximity to this operation. Moving forward, I would also very much appreciate an update your response.
Can you do me a really big favor?
Sure. That were noted.
I'm gonna take my key and put a new battery
I
in
would
it.
also like to point out that there were possibly more violations and illegal activity that were not noted due to the fact that Mr. Moore was given notice of your visit and that the massive amount of cultivated and flowering marijuana on his property had already been harvested a couple of weeks prior to your visit. Additionally, I would also note that Mr. Moore has been attempting to operate a large marijuana cultivation industry for the past 15 years and has done so illegally and with disregard to how this operation affects those living in close proximity. He was shut down twice by law enforcement for growing illegally. When Mr. Moore applied for a permit under the jurisdiction of Mendocino County after the cultivation of marijuana became legal, he was granted that permit with what appears to be little process for input from the residents of our neighborhood. As a government agency employee myself for 20 years, I have been involved in projects that involve the development of an industrial nature. There is always a process that includes the voice of residents that may be impacted by the project and the impacts it would have on the environment. I feel like this particular operation was shoved down our throats, for lack of a better analogy, and so do my neighbors. He brought in outside investors, scaled up to industrial levels, and did so in violation of your own codes, as you became aware of it in your visit to his property. When other growers in our area applied for permitting to be grandfathered into the Mendocino County Cannabis program, there was a process and notification for the residents to weigh in. And that resulted in opposition, and Mitchell Creek was abandoned as a legal grow area. So I would like to just ask you two questions in follow-up to this letter. One is, the site, as a governing agency for the cannabis program, and
Ms. Pine, I'd like to ask you, what were your last two questions?
thank you, Dan. I appreciate that. My questions were, as the governing agency for the cannabis program, in regards to the Mitchell Creek operation, how many chances should one person get to act in a legal and responsible manner? My second question was, does Mendocino County have the resources or the desire to provide the oversight that appears to be necessary to keep this individual in compliance and the neighbors from experience the impact of his operating illegally? Please consider assisting us in the revocation of the permit renewal for this person. Thank you very much for giving me extra time.
Next is Jude Thillman.
Good morning. My name is Jude Tillman, and I'm speaking on behalf of MCA in support of review and prioritizing of existing directives issued by the Board of Supervisors in relation to county cannabis policy. First, a note about your directives regarding water hauling. All lawful businesses using lawful water sources should be treated equally. County policy must not conflate illegal water use with all cannabis legitimate water use, and to do so would be unfair and discriminatory. Secondly, I want to offer some more feedback on some inconsistencies of the current review of cultivation applications. Due to the necessary abandonment of ordinance changes to 2218 directed by the Board of Supervisors, new changes to 10A17 must be prioritized to make it more effective and function as it has in the past in a discretionary fashion. On this point, MCA has recently been offered further evidence of current inconsistent treatment of applicants by the county in comparison with past county practice. And I share that with you now, principally for the benefit of those of you who are relatively new to the board. In early 2018, a phase 1 applicant was offered a compliance plan through which this person could rectify some identified violations and secure a permit. These violations were neither less or more egregious than the many that are currently cited to toss applications out of the queue. The 2018 cover letter says simply, sign the bottom of the cover letter, take the letter to the tax collector's office and pay the permit fee, and bring the issued receipt for the permit fee to the Department of Ag. The letter is signed by the Cannabis Program Director at the time, Kelly Overton. The attached to that letter, the attached compliance plan states that its purpose is to, quote, enable early issuance of a Mendocino County Code Section 10A17 Phase 1 permit to cultivate cannabis, based on the agreement of the undersigned applicant to correct all violations identified in this plan, to obtain and finalize all required separate county permits, to obtain any required certificates of occupancy, and to abide by the restrictions as set out in this plan, end quote. If this isn't discretionary, I personally am not sure what would be. I'd like to thank you now for your due diligence in moving our cannabis permitting program forward.
Next is Ron Edwards.
Good morning, board. Day 2 of this week. I'm calling this morning to talk about a couple of issues. It would be nice to get an ag update on how the hemp program went and what the plans are for that in the coming year as we're getting close to planning time and planning for that one. It's also interesting that the Ag Department is actually interesting having the director of the Ag Department make calls on regards to scales. It would be much better if the cannabis program would coordinate with the Ag Department to make sure that those scales are all updated correctly. And yesterday's meeting was very informative on how the board reacts to different issues. At the end of the meeting on the 14th, you were brought the issue about 2218. It was a presentation on where things were, but there was no call to action. Yet yesterday's board meeting, at the very end, Supervisor Williams was very adamant on wanting to go forward on the salary issue without a plan and starting an ad hoc committee. You were very forward on that, yet with cannabis, we're going to be splitting this up in public expression, meeting after meeting. I think we really need to address it. There are a lot of issues, and a standing committee really would be a better way to address all of these small, fragmented comments. And rather than just comments, we should have an action plan. We should have next steps. We should know where the portal is going, and particularly the grant money. I mean, as I said before, you are giving out this money, you're about to send it back to the state, and you have really no idea of where you are. Do you have to adjust the qualifications to make sure that all that money is sent out to those who are affected by it? And really beyond this, I mean, it would be just, again, ridiculous to send part of that money back to the state when that could be used to help the few operators who are still going forward and trying to work on this program. And I think that really needs to be the focus as we're getting down to fewer and fewer people through the portal. Thank you.
Last on the line is Michael Katz.
Good morning, supervisors. This is Michael Katz, Executive Director for the Mendocino Cannabis Alliance. I invite you to imagine the following scenario. You are in the middle of an ocean, your boat just having taken on water and disappeared beneath the surface. You tread water in hopes that another vessel will come upon you and help pull you to safety. You do what you must to survive, and you hope. Now imagine a boat appears in the distance, getting closer and closer. As it nears, from the deck, a life preserver is thrown towards you, but it's just out of reach. You swim to catch it, but the boat does not slow, and the life preserver moves farther and farther away, ultimately disappearing into the horizon. I ask you to imagine this because it is a potential outcome for Mendocino cannabis equity applicants at this time if we do not adjust course and improve access to local equity funding. As of this writing, our understanding is that not a single dollar of equity funds for a direct grant has been distributed to an applicant, and only a few fee waivers have been granted. As we have been told countless times, if the first award of $2.2 million is not distributed by February 2022, the money will be returned to the state. A life preserver disappearing into the horizon. This board committed on July 20th to revisit the efficacy of the equity program in September, yet it is not agendized this week. And according to the Mendocino Cannabis Program, will likely not be agendized until October 19th, at which point will be less than 4 months from the initial disbursement deadline. We recommend that the board remove all barriers to receiving funds applied for by the current cohort of equity applicants. Any further delay in distribution of these funds will only serve to further harm this group, who have already been harmed by the war on drugs. While some of the restrictions and barriers that were built into this program may have had positive intentions on the part of the board, it is clear that the program as it is currently designed and being administered is not supporting its primary purpose. As such, we recommend the following immediate actions to reduce unnecessary barriers to access. 1, please call a special meeting or add the equity program reform to the agenda for October 5th to address the state of the program. 2, if someone is deemed eligible for grant funding, they should be able to receive all funds as soon as they are available, especially given the significant time crunch we are under and the fact that no direct funds have yet been dispersed. 3, please direct Elevate Impact to report every 2 weeks on how much funding has been applied for and distributed out of the available funds. 4, set a requirement for a representative from Elevate Impact to return emails or phone calls within 48 hours of receiving outreach for an applicant or a potential applicant. And finally, please direct staff to apply for equity grant funding for the next equity grant cycle. The Cannabis Program Manager indicated that they might not have enough staff to do this, which is very disappointing considering the needs that this community has for funding to support them in this difficult effort. Only the board has the authority to correct these issues. We urge you to act now. Thank you.
That concludes public expression, and there are no telecomment requests for the consent calendar or closed session.
Thank you. On the consent calendar, are there any items board members would like to pull for discussion? Okay. Would someone like to make a motion to approve the consent calendar?
Move approval of consent calendar.
Second.
Okay, we've got a motion and a second. Alice, can you connect roll call?
Yes. Supervisor Mulhern?
Yes.
Supervisor Williams?
Yes.
Chair Jurdy?
Yes.
Supervisor McGorty?
Yes.
And Supervisor Hashak?
Yes.
The motion carries unanimously.
Okay, great. Well, that takes us to item 5A, which is update on COVID-19.
Good morning. And thank you, Chair Jurdy, Supervisors, and CEO Angelo. Our post-Labor Day surge seems to be decreasing now with decreasing cases and hospitalizations, though we're continuing to deal with 4 significant outbreaks in the county, and we're experiencing the aftermath of the surge in the form of increased mortality recently. I'll start with the data. The daily case rate is now 36.67 per 100,000 per day, down from a peak in the last 2 weeks up to in the range of 50. Testing in our county has remained high, and though there were some logistical errors made by the state testing teams last week, this week we hope to correct that with testing in all the major population areas in the county 1 to 2 times per week. Test positivity, while higher than the state, has come down from to 6.9% from 10% that it was a month ago. In the hospital, there are now 14 people in med-surg plus 4 people in the intensive care unit. Of these, 5 are Mendocino residents, and 2 are people that we are caring for from out of county. Recently, we've seen our first pediatric case in a local hospital. Today, we have 1 or 6% of the available staffed ICU beds in the county. Totals in isolation are 222, and quarantine, there are 81, and we're providing housing and other services for 10 residents. The number of COVID deaths now amount to 82 Mendocino County residents. In the last 2 weeks alone, the toll coming off of the summer surge has been 13 additional, or 16% of all of our COVID deaths. We've seen a rise in cases, hospitalizations, greater than we saw last winter, despite the availability of safe and effective vaccines now. While some vaccinated people have caught COVID and some have passed away, the vast majority of overall of severe cases, hospitalizations, and deaths are among those who have not been vaccinated. The average age of the non-vaccinated who recently passed away was 68, compared with those who were vaccinated, who were 95 years old with significantly more comorbidities. Additionally, 8 who passed away in the past 2 weeks were from 2 nursing home outbreaks, each with low staff vaccination rates. And in those skilled nursing facilities, the staff who tested positive were predominantly unvaccinated. So while the surge in Northern California is affecting predominantly unvaccinated at a rate of 10 to 1, it is also having fatal consequences on those who are vaccinated and vulnerable, who are populations in contact with the unvaccinated caregivers. It is because of experiences like this that vaccines are being mandated for healthcare workers, school teachers, and staff, and in our county EMTs, fire and law enforcement personnel, as well as other first responders. I'm going to move now to outbreaks. We've had 4 major outbreaks within the which the Department of Public Health has been focusing on. One is our county jail, which successfully contained and closed 1 outbreak until a new arrestee came in with COVID. And at this point, 6 total cases of COVID had been uncovered in the jail in a new outbreak. In Round Valley, Covelo, northern Mendocino County, 56 cases have been identified, and they are experiencing a continued outbreak, which the Round Valley Indian Health Center is working heroically with state outbreak response team on testing, contact investigation and tracing, isolation and quarantine, and the administration of monoclonal antibodies. But again, I want to mention that though Round Valley Indian Health Center is taking the lead in controlling this outbreak, it really is Covelo and northern Mendocino County which this outbreak is occurring in. 2 skilled nursing facilities have had outbreaks and are ongoing. One is Redwood Cove in Ukiah, the other is Sherwood Oaks in Fort Bragg, and each have had significant outbreaks, and they are each working with state resources to control and mitigate their outbreaks. In the schools, we continue to focus on them. It has been reassuring so far. There have been a total of 28 COVID exposure events involving students or staff. These were all identified and contained through the robust testing programs and contact investigation and tracing being performed by school staff with public health oversight and consultation. In spite of all these events, there have been no outbreaks in Mendocino County schools so far. So these generally have been infections that were detected that were brought into the schools from the community, from homes. This is a credit to the staff who are being pushed to the limit while still carrying out their usual responsibilities for the children. So now I'd like to turn to vaccinations, which is our best hope for returning to normal. As of this morning in Mendocino County, we've administered a total of 106,078 vaccines. This represents full vaccination of 69.4% of our eligible population, and or 79.2% of those who've had at least 1 vaccine. From an equity perspective, we have fully vaccinated 78% of those in quartile 1, the least resourced population in our community, and 65.3 in quartile 2. And this latter quartile 2 is for the first time less than the state. We've usually done better than the state average in quartiles 1 and 2, and the quartile 2 average is a little less than the states, which is unfortunate because that is the group that is the most populous in our county. By age, those from 12 to 17 have had 44.3% have been fully vaccinated, and this is a little less than the state. Those 18 to 49, 63.5% are fully vaccinated, and this is lower than the state. And this is also a key group that is suffering from more cases than we would expect. Those from 50 to 64, 81.5 are fully vaccinated. Of the 65 and over group, 77.1 are fully vaccinated. And both of these groups are above the state average for acceptance of the vaccines. As far as racial and ethnicity data, non-Hispanic Caucasians have been 65.7% have been fully vaccinated, and this is greater than the California average. And among the Hispanic in our county, 55.9% are fully vaccinated, and this is greater than the California average. So we can see that there is continuing to be a gap between the Hispanic and non-Hispanic Caucasians, but that gap is narrowing with an increased rate of uptake in our Hispanic community. And this, in many ways, is through the educational work of our promotores in the county. Native Americans have had only 52% fully vaccinated that are recorded, and this data is very questionable. It may underestimate the numbers slightly due to reporting issues, but there is clearly a major disparity, and it tragically is fueling in many cases in the Round Valley outbreak. As far as vaccines, there's a lot of news here. So it's, and it is confusing, so I'm going to review it. The efficacy rates from the efficacy shows that we have 3 very effective and state vaccine and safe vaccines available in the United States, the Pfizer, Moderna, and Johnson & Johnson. That is important to keep in mind. Earlier this month, Pfizer and Moderna vaccines were approved for 3rd dose for people with conditions that prevented them from mounting the normal protective response with the primary 2-dose series. So we call this a 3rd dose that we're recommending for those people to get to the expected immunity. And that is part of the primary series. Late last week, the booster shots were approved for Pfizer only, and this is not Moderna. The 3rd dose is available for Moderna and Pfizer, but the booster's only for Pfizer people at this point, though Moderna will probably be approved soon. Boosters are given to boost the immunity for those whose immunity was high but may be waning. And this is the same vaccine and the same dose as their primary series. And it is noteworthy that for most people, the immunity is not waning, but in the group of people for whom the boosters are advised, there may be some waning of that effect. So the Pfizer recipients whose first shot was 6 months ago, among those people, there are some who should and some who should consider having the booster dose. So those who should get the booster are 65 years of age and older, long-term care residents who are at higher risk, and those people who are 50 to 64 with underlying medical conditions or increased risk due to social inequities, for example, Hispanics, Blacks, Native Americans, or disabled. And those who may consider receiving the booster are those who are from 18 to 49 years old with underlying medical conditions, and those who are 18 to 49-year-olds at increased risk of exposure because of their occupation or their occupational setting. And they may also be at risk of transmitting because of those circumstances. So I want to emphasize a couple of confusing issues. The first priority that we have in this county, statewide, nationwide, is to give the initial dose. These folks should can go to any event and can request their primary vaccine. If there is any shortage at the site, they go to the head of the line. Those are our priority people. The vaccine that we're giving is very effective, and it needs to be given to those people who are not vaccinated. 3rd shots are part of the primary series for a select group, and they are a priority. The boosters are the next priority, and we need to pay attention to the shoulds and the may considers. They are not emergencies like the primary series, so we don't want to overwhelm our capacity in public health. We have no material shortage at this point, but the staff and logistics continue to remain issues. So where do we get the vaccines? The public health department will be administering the vaccines at the fairgrounds on Fridays, and we also will be having regular vaccine events each week in Willits on Wednesdays and Fort Bragg on Tuesdays. The clinics and the hospitals are also having some events. For availability, we recommend people to the county website or vaccines.gov. And to schedule, they should use myturn.ca.gov or the phone 833-422-4255. And the drop-ins are possible in most of the events. Pediatric vaccines, let's move to that now. For the 5 to 11 years old are being reviewed now for Pfizer and hopefully will be available by mid to late October. We expect that Moderna is going to follow in each of these cases, but Pfizer has already put in their request. And we're preparing for these vaccines to be given in provider offices, as well as special events to be hosted in schools involving vaccinators experienced with treating these young people. We also are hoping to have available a vaccine for children 6 months to 5 years old in December, January. And providers' sites will be utilized for these because it'll be much more comfortable for the smaller children and their parents. So in summary, I want to step back, and I have to say that I am amazed to have seen that we have a science identify a pandemic thousands of miles from our shores, work together across national divisions to develop a vaccine that control it in less than 2 years. And this vaccine is better tested for safety and effectiveness than any prior vaccine in our history. While fear is gripping a large portion of our population and seeding confusion and even resistance, this fact that we have these vaccines are safe and effective should provide us some hope. But we must not be complacent because we need all our forces and then some to conquer this COVID. The cases and hospitalizations are gradually decreasing from the summer and Labor Day surges, but we are not down to the rates that we achieved before the summer surge, and this is a potential hazard as we go into the fall season. It took us 2 months from the winter surge to achieve the low levels that we did before the summer surge. And we see how much more devastating the summer surge was even for us than in the winter. So we have to begin to plan for things like Halloween and Thanksgiving and Christmas because we know they ushered in major lockdowns last year, and they could do it again if we don't carefully plan our celebrations and increase our vaccinations. We're currently struggling through to contain 4 outbreaks, which have claimed many lives recently. As we've seen, this pandemic is driven by and affecting mostly the unvaccinated, but transmission to their vulnerable contacts has also been devastating. So we have various vaccine mandates for fire, EMTs, first responders, and have recent recommendations for businesses and restaurants and bars to verify vaccines or regular testing for their employees, and also to verify vaccine status for patrons. But these are recommendations. They are coming into effect in the next few weeks, and early next month, restaurants and bars will have to post their level of compliance for citizens to be able to make an informed and free choice. Vaccines are our way back to normal and should prevent and could prevent another variant from emerging. We need to reach many more for their primary series and fortify those who need third doses who may not have been able to mount an adequate immune response. We have approved boosters for groups that may be waning in immunity. And finally, pediatric vaccines are coming and just in time as we are now experiencing our first pediatric hospitalized case, which raises a specter of a pediatric pandemic. If we're going to beat this and get back to normal, we need everyone to participate, from volunteers at vaccine events to everyone following non-pharmacologic interventions, and also reminding and cajoling family members and friends and helping them to get their vaccine appointments. So we have a lot to do in the next 6 months, and if we succeed, I think we really can beat this pandemic. And with that, I'll end my presentation and stay here for any questions.
Any questions? Okay, not seeing any. Do we have any help? Supervisor Hashak?
Yeah, I'd just like to say to Dr. Koren, thank you very much for that. It certainly lays out what we're dealing with and the path forward, of getting vaccinated. So thank you and everyone else who's working so hard on this. I appreciate it.
Thank you. Supervisor McGordy?
So I got my booster because I'm 65 years of age and older. And I just have a question for you, though. One of the things that I think is misinformation is that people are saying that if you're vaccinated, you're more likely to move the virus around. And I'd just like your professional opinion on that.
Oh, yes, there's been a lot of concern because the counts of viral loads in nose swabs of people who've been vaccinated are present and can be as high as those in people who are unvaccinated and are sick with it. The difference is that the people who are vaccinated can fight these off. And indeed, although some get sick and some may pass it around, they're actually probably only carrying that load for a 2 or 3 day period of time, whereas the people who are unvaccinated can carry it and spread it for a lot longer. So although, yes, there's research that has shown that those people vaccinated can carry the virus, there's no way that a vaccinated person is going to spread it more than an unvaccinated person. The problem is, of course, when you're around either family, friends, or at work who are more vulnerable, then even the vaccinated people have to be very careful.
Thank you.
Okay, Do we have any members of the public who wish to comment on this agenda item?
Yes, we do. We have Carrie Shattuck on the line. You can go ahead and unmute and begin talking whenever you're ready. You'll need to press *6 on your phone to unmute. Okay, one last time. Carrie, if you press *6 on your phone's keypad, you should be able to unmute and then you can begin talking. Okay, Carrie, you appear to be unmuted. Chair Judy, Ms. Shattuck is appearing to be unmuted on our end, but we aren't hearing anything. What would you like to do?
Do you have any other speakers?
Not for this item.
Does Ms. Shattuck know that if she's on a phone, she could push *6?
Yes, and she is unmuted. We just aren't hearing anything.
Okay. All right. Well, then let's.
Okay. Is it working now?
Yes, it is.
I'm sorry. I apologize for that. Okay. Good morning. My name is Carrie Shattuck. The Board of Supervisors meetings need to be open to the public outside if necessary. The comments are turned off. This is unacceptable. We are not being heard. Public expression is being censored. There is no state of emergency that necessitates us being kept from your meetings. Dr. Corrin is a one-man rule at this point. He is making orders well beyond what the state is recommending. I feel our county is ground zero for orders that have no legal authority. The Board of Supervisors is allowing this and has taken a back seat to our rights under the Constitution. The county is discriminating based on medical condition, whether you're vaxxed or unvaxxed. Vaccinated are spreading the Delta variant. The county will be liable as an employer for requiring this experimental injection for employment. Dr. Corrin needs to resend the order for employers taking effect on Thursday. Dr. Corrin's tiered signage for businesses is segregation, making businesses once again take a stance as to where they stand with their customers. So much for choice. This is tyranny, and this order needs to be rescinded as well. I'd really like to know who else is paying Dr. Corrin other than the county for his position. I'm looking into that now. Whose agenda is he pushing? The Board of Supervisors will ultimately be held for crimes against humanity. I hope that the Board of Supervisors takes a serious look at their choices, as you will be held accountable by us, the public, that you are elected to serve. You pledged allegiance to liberty and justice for all. That is not what Mendocino County residents are receiving. Thank you for your time.
That concludes public comment on this item. And as Deputy Clerk of the Board, I do want to clarify that comments have remained open. The e-comment function is currently enabled. I just double checked it. So that the write-in option is still open.
Any other comments on this agenda item? Supervisor McGorty, your electronic hand is raised. Okay, all right, thanks. All right, well, then we'll go to the next item, which is 5H, discussion and possible action, including review of the let's see, and adoption and ratification of legislative. What's the legislative update?
Chair Jurdy, this is CEO Angelo, and Deputy CEO Judy Morris will be doing a legislative update to this board. And there she is. I know that she's been having
Hi,
some technical difficulties.
this
There
is
she is. Thank you.
Judy. I'm having tech issues, so hopefully you can hear me. There's some bandwidth issues on my end, it seems. So if I disappear, you know what's happened. Good morning, Chair Jurdy and board members. The governor. So I'm certainly not going to try and tackle all of those. Some of them have not even been signed yet. The governor has till mid-October to finish signing legislation. The variety of legislation is, of course, water safety, cannabis-related services. But for today, I think I'll try and pass on some good news regarding housing. There's certainly a full slate of to help increase housing stock throughout the state of California. SB 8, 9, and 10 all help with increasing. Oh, here we go. I don't think you can still hear me. I think I just got kicked off the network.
No, Judy, we can hear you.
Oh, okay, great. Thank you. It's very odd. So SB 8, 9, and 10 and AB 1174 have helped to increase housing stock through California. SB 8, known as the California Home Opportunity More Efficiency Act, otherwise known as HOME Act, certainly will allow homeowners to have some more flexibility, easier approach to lot splitting and also adding housing to their property. SB 9, of course, also at the same time protects existing renters and also historic districts, fire-prone areas. So there are some protections in SB 9. SB 8, of course, extends the Housing Act of 2019. Much of that was able to help with some housing issues, especially during COVID. SB 10 establishes some voluntary streamlined processes for local jurisdictions to zone for multi-housing units, whether it's the city or the county. Also, AB 1174, an urgency measure that makes changes to the existing streamlined ministerial approval process for housing development in jurisdictions that have not quite yet made enough progress on their allocation of regional housing needs. So
Judy, your audio seems to be temporarily lost.
Mr. Chair, maybe we can hear this item in the afternoon. Ms. Morris has better access.
Okay.
Perhaps you could call in rather than trying to use her internet service rather.
Okay, so we're going to come back to item 6A, or I'm sorry, 5H, and we'll go down to 6A, which is tax share agreement brought forward by Supervisor Mulhern.
Thank you, Mr. Chair. For quite some time, the Ukiah Valley Fire District and the City of Ukiah have been working on creating a merger. They have a JPA, which was included in our agenda packet. Both of their boards voted to move forward with this tax sharing agreement so that they can continue the LAFCO process, and the City of Ukiah will actually be brought into the Ukiah Valley Fire District.
Okay, are there any staff comments you're looking for this item?
No.
Okay. So we don't have anyone, I'm just looking at the clerk, do we have anyone from the city or from the fire district or members of the public who wish to comment on this agenda item?
Yes, we have one person on the line. Oh, it appears that we did have Sage on the line, but it looks like he hung up. Oh, and now he's back. So first and last on the line is going to be Sage.
Hi, good afternoon. I was having trouble connecting. Can you hear me okay? Great, thank you. I don't need to take any more time with this item. I think everything is spelled out in the report, but do want to thank the Board of Supervisors and the Ukiah Valley Fire Protection District and all of our partners here at the City of Ukiah. This is really a monumental effort to consolidate fire services for the betterment of protecting our community. And I can't think of a better time for this to continue and this evolution to occur. And certainly appreciate everybody's support and help in making it happen. Thank you.
Hey, thank you. Supervisor McGordy.
This is a question for Supervisor Mulhern and maybe Sage as well. So I know that there was some concern about LAFCO about Ukiah's sphere of influence study and some of the other, when we were dealing with the sanitation districts. Is that not an issue now?
No, with the direction of the board, I can maybe answer that.
Go ahead.
Great, thank you. No, updating our SOIs are tremendously important. What's happening with this one is an updated SOI for the Ukiah Valley Fire Protection District is simultaneously happening with this application. So it didn't need a City of Ukiah SOI update. It needed to have an update of the district to be inclusive of the city.
Thank you. I see a hand raised in the chambers.
Working. Thank you, Mr. Chair. So I just wanted to clarify in response to that question. You know, this part of the process. So this is part of the annexation process that's provided under the statute, and as part of that, the board's role is to be negotiating on behalf of special districts for any change in the allocation of the base property tax rate. And there's a period of sort of 60 to 90 days that's provided for in statute. In this case, essentially the board and the district have asked the city and the district have asked the board to simply sign off to no change as part of this annexation based on a variety of factors and alternate revenue source. So this wouldn't be directly impacted by the sphere of influence study. This portion of it is really just the tax sharing allocation piece of the annexation.
Thank you.
Thanks. Supervisor Williams.
Move the recommended action.
I'll second, and I just had a quick note. I'm not sure if Supervisor McGordy still had a comment.
No, I don't.
Thank you. Yeah, I just wanted to note that this is really just one piece of a process for this to move forward, and still has to go through LAFCO processes. So I really do want to thank the team, the City of Ukiah and the county, and it was a really quick turnaround, and they did a great job making it happen. So I really appreciate everybody jumping in to make sure we can move this forward for this year.
Okay, thank you. So we have a motion. Sorry, did we have a second? Okay, we have a second. Can we have roll call?
Was there public comment?
And we did ask for public comment, and that Sage, I believe, was the only public comment.
That is correct. Supervisor McGordy?
Yes.
Supervisor Hashak?
Yes.
Supervisor Mulhern?
Yes.
Chair Jurdy?
Yes.
And Supervisor Williams?
Yes.
The motion carries unanimously.
Okay, that takes us to item 6C, which is response to the grand jury reports.
Thank you, Mr. Chair. So as part of the annual grand jury report process, the board is required to respond to certain of the findings and recommendations. This is the product of the work of the ad hocs. I would like to thank both of the ad hocs very much for all the time that they had put in, and I think it may be best to give them an opportunity to sort of address them one at a time if there's anything in particular the ad hocs would like to speak to.
Supervisor Hashak.
Thank you, Chair Judy. Just, I worked with Supervisor Mulherin on the housing and the homelessness grand jury reports. And I think that the issue, like Judy Morris, Deputy CEO, brought up earlier, that the state is really focused on the housing. I think that what we heard yesterday from in the presentation about our workforce is there are certainly issues with housing. And I think that it ties into the homelessness issues too. So I just believe that there's a lot of work that the board needs to do and really put a lot of focused energy around housing and what we can do, innovative approaches. I'm hearing things about what's going on in Fort Bragg. Ukiah seems to be adding a lot of housing stock, and I think that the county can do more. So I think that we really need to be working with planning and building to increase the housing stock and different approaches to increasing it.
Okay, thank you. Supervisor Moore.
Thank you. Just for the housing and homeless ad hoc, I think that there still seems to be a lack of communication with the public about the work that the county is doing and our partners are doing around homelessness and housing. And I think it's important that we try to figure out a strategy to communicate so that everybody is on the same page. And I'm not sure if that's using websites. The Project Home Key Mendocino website is a really useful tool. I refer people to that site very often. So maybe there's an opportunity for a public forum or a website page that'll better inform the community, not only about what the county's teams are doing around homelessness, but also what the COC and the service providers that are working together are doing around homelessness. They have a great project that they did, 100 Days for New Housing, over the summer and housed 36 homeless individuals in less than 100 days. So there is a lot of work being done. I think we just need to better communicate that with the public.
Thank you. Supervisor McGordy.
So I agree that we're doing a pretty creditable job in trying to help homeless people and low income people. Two concerns. We need more housing stock for people who are looking for something that's the next level up, particularly people who want to own homes. And I also have a concern about water insecurity in some of our communities and how we're going to balance that out. I realize we're not going to be in a drought forever, but we also have a finite supply of water in some places. I think of Redwood Valley and Fort Bragg and the coast as examples of where water security is a big issue. So those are two things to keep in mind. And I think the idea of having maybe some discussions with the planning and building about what things are sort of being forecast for development to kind of get a sense of where our home stock is going, what projects are on kind of the radar, and what might happen next would be worth doing.
Thank you for those comments. And I'm hoping that as the planning department builds its advanced planning team, that would be exactly the type of workshop and work that they'd be focusing on. The proposal by the Inland Housing Action Team, community members, and the Coast Housing Action Team that went to the board for the PG&E funds wasn't funded, but I think it was an idea that I hope has a life beyond the PG&E funding, and that is to create a housing land trust that the county would create the city of Ukiah has already created not a housing land trust per se, but a housing revolving loan fund. And the city of Fort Bragg's looking at the housing land trust. I think you couple those two ideas together, you can, if you can get site control of a piece of property and provide upfront funding for the pre-development costs, you can get a project ready to roll. And that's, I think, how you make projects available for people who are in the workforce. I think, as we've noted, most of the state funds that seem to be available are for people in the very low income categories. But there's almost nothing, unless local government funds it, that will provide any kind of subsidy or reduce costs for people who are just sort of middle class. And so I think they're really the people who are missing out in government housing programs. So that might be a duplex, it might be something smaller than a single family home, but something that's not looking like an apartment building either. So anyway, those are my thoughts on the housing, and I hope we are able to work on that. I think it's an issue that we as a county need to spend more time on, and I hope we can with the advanced planning team. Supervisor Williams?
Is there room to enhance our legislative platform to push the state for less regulation? All of the regulations related to building look like good ideas in a vacuum, but when you look at the aggregate of the regulation, it puts Mendocino County in a position where housing only makes sense if we can subsidize it. And you'll never be able to subsidize housing for market rate, which is where we really need more housing. Do we want to nudge the state that this simply doesn't work for Mendocino County? Developers won't build because wages don't support the costs of implementing all of the regulations. Sprinklers come to mind. Sprinklers are a great idea, but you start adding, that plus study after study after study, and we see building come to a halt.
Because certainly on things that are legislative platform, I'm not sure how receptive they'll be to amending the building code for rural America. California. We do have the Class K building code, but that only applies to rural zone parcels, not to what you might consider suburban residential neighborhoods.
Okay, and then the other question, land use is local. The county could decide to create more parcels. We could change zoning to make land cheaper. Is that a direction we might want to go? And is that something we could ask planning and building to look at and report back?
Well, I don't necessarily agree that creating new parcels makes land cheaper. I think what makes land affordable to someone to purchase is you have a nonprofit that owns it and and manages the development for the benefit of people within a certain income group. Supervisor McGordy?
Well, I basically support Supervisor Williams' idea about at least bringing it forward to the state via RCRC or CSAC that we have concerns, because what works well in an urban area doesn't necessarily work well in a rural area. And I also agree with Supervisor Jordy that having a kind of advanced planning capacity inside of our planning building services is something that we look forward to seeing happen as we staff up, because we need it. It's clear that we're not meeting the needs of the community, and therefore we're having trouble keeping people here to fill positions. And we had a big discussion yesterday about how we're falling behind in staffing Mendocino County. So I'm sure this is a contributing factor, and if there's some way that we can address it.
Thank you. Supervisor Hashak?
Thank you, Chair Jordy. This Willits Unified School District has about 6 acres, kind of in the middle of town between two schools. It was excess property that they're not using anymore, and that they're considering selling it for housing. I think it'd be a perfect opportunity to work with maybe the city of Willits, the Willits Unified School District, and the county to work on some workforce housing and see what we can do as far as land trust or something. There's different models that we might approach. And I think that we need to start being proactive in some of these areas where we see opportunities. So I would like the board to give direction or to form an ad hoc or something to try to pursue some of these options.
Okay, well, I'd be happy to work on an ad hoc with any other supervisor on the housing issue.
I'd like to be on it.
Supervisor Moran, I'm sorry.
I was volunteering as well.
Okay. Well, so I don't want to get in the way of the other. So
You can go ahead.
Okay. All right.
Mr. Chair, feel free.
Okay. All right. So I guess by direction of the board, we'll create an ad hoc committee to bring back to the board ideas and suggestions for housing consisting of Supervisor Haschak and myself. Supervisor Williams, perhaps you want to go over any highlights of the response on the IT?
We generally agreed with the grand jury's findings. If there are any questions, happy to answer. Sounds like none.
Okay. Do we have any public comment on this agenda item?
Yes, we do. First on the line is Patrick Hickey.
Good morning, Chair Jurdy, board members, CEO Angelo. My name is Patrick Hickey, and I'm speaking on behalf of the Mendocino County chapter of SEIU Local 1021. SEIU Local 1021 represents over 1,000 public employees in Mendocino County, workers at the county, the Superior Court, Mendocino College, and the city of Fort Bragg. A complaint and concern brought up at many chapter union meetings has been the lack of affordable housing in the county. As we heard more and more stories of employers struggling to find qualified candidates because of the lack of housing, we established a working group to investigate this issue and determine what we could do to help address this problem. Mendocino County, like much of California, is experiencing a housing availability and affordability crisis. The lack of housing is driving up housing prices and rents. It's impacting employers who are unable to recruit workers because of the historically low vacancy rates and slow pace of new construction. This is making it harder for young people who have grown up here to find a place of their own. The reasons for the housing crunch are varied and complex. Construction worker shortage, burdensome and expensive permitting and development fees, housing being converted to short-term vacation rentals, water and sewer hookup limitations, housing stock loss due to wildfires, limited sites available for development because of zoning, fire danger, and coastal restrictions. Mendocino County's population is relatively stable, and growth is projected to be modest over the next 5 years. So meeting the county's housing needs should be an achievable goal. The shortage is not just in the affordable housing segment, but with middle income housing as well. Municipalities and the county government have taken steps to address the housing shortage with some success, but more action is needed. There are many local organizations that have been working on this issue. They have helped raise awareness about the problem and have made progress in crafting solutions to address it. The Housing Action Team and the Anderson Valley Utility Service District submitted a comprehensive list of recommendations that is included in Appendix B of the county's housing element that we cannot improve upon. It provides a roadmap to addressing the multifaceted challenges that have led to our current housing shortage and the steps we need to take to emerge from it. We urge you to review and implement these recommendations. Thank you.
Next on the line is Karen Matson.
Dear Chair Jurdy, board members, CEO Angelo, my name is Karen Matson with SEIU. I'd like to start with a quote from a county employee in Fort Bragg. I can think of a half a dozen employees that the county has offered jobs to here on the coast, but they had to turn down the offer because they couldn't find anywhere to live. As one member who responded to the survey put it, someone who works for the county should be able to afford to live in the county. In our inquiries, We heard many stories of new employees living for months in motels or campgrounds while they searched unsuccessfully for a home to rent or buy. Of those surveyed, 46 rent, 38% own their home. 12% of respondents reported living outside of Mendocino County because it is too expensive or they were simply unable to find housing. Survey respondents identified home ownership as a top goal, but expressed doubt of whether this dream could be realized. Something that came up again and again was the precarious nature of the housing situation for respondents. Something we found troubling was the high percentage of income that employees reported paying toward housing costs. 23% are paying between 40% and 50% of their income, and 32% report paying 50% or more. That is not sustainable or healthy for our local economy. A shocking finding in the survey was the high number of respondents, many with stable full-time employment, who find themselves living on the edge and unable to find stable living arrangements. Of the survey respondents, 22% have experienced homelessness, with 3% currently homeless while working. Another theme that came out of our surveys was distress and anxiety about being able to establish roots here in the community. They are often in temporary living situations with family or roommates, but unable to achieve the independence that they thought permanent employment would provide. A problem identified on the coast is short-term vacation home rentals. As a tourist destination, there has been a trend of single-family homes being converted to short-term vacation rentals. The city of Fort Bragg and the town of Mendocino have taken steps to limit or block this, but in the unincorporated parts of the coast, these short-term rentals have proliferated. The county did pass a temporary moratorium in 2017 with the intent to make it permanent, but this has not occurred. We would like to highlight 4 recommendations that we believe would have the most impact on housing development here in Mendocino County. 1, we call on the county to dedicate staff time and resources to the Mendocino County Building Trust Fund to help support housing development. 2, we call on the county to dedicate staff time and resources to seek out housing development grants and funds from state and federal resources. 3, we call on the Board of Supervisors to pass.
That concludes public comment for this item.
Karen, can I ask her? She sounded like she had one more point she wanted to make.
It appears that she has already hung up.
Okay, well, hopefully, if she hasn't already, she'll send us an email with her comments. Okay. I guess there are no other comments on this agenda item. With Supervisor Williams.
Move the recommended action.
Second.
Okay, we've got a motion and a second. Can we have a roll call?
Chair Jurdy?
Yes.
Supervisor Hashak?
Yes.
Supervisor Williams?
Yes.
Supervisor McGordy?
Yes.
And Supervisor Mulhern?
Yes.
Motion carries unanimously.
Okay, do we know if Judy's able to call into the meeting to finish up the legislative update?
I just spoke with Deputy CEO Judy Morris, and she let us know that she will be presenting her ledge update at the next board meeting instead of today.
Okay, great, thanks. So I'm looking at the clerk of the board's office or CO. We have a number of items in the afternoon, and we also have quite a few closed session items. Is it the preference that we go directly into closed session, or that we take up any of the afternoon items?
Go ahead, Atlas.
And speaking with the CEO, the preference would be to go to 6B next, and then possibly 5B if time allows. And one item was pulled from closed session.
Yeah, Chair Jurdy, this is CEO Angelo. I think we have enough items scheduled in the afternoon that we could move to the morning. Since it's only 10 o'clock, I believe we could probably get through at least 2 to 3 of these items if the board chooses. Thank you.
Okay, well, if we're ready to take up 6B, which is the strategic planning process, let's take that up now. Supervisor Mulhern.
I was hoping we could have a 10-minute break before we take up that item.
Sure. Okay. So it's let's come back at 25 minutes after 10.
And also, I request that we have Ann Mulgard on too to help us with the update on our strategic planning.
Okay. All right. Thanks. Okay. This is to item, let's see. We're going to item, let's see, 6B, which is the strategic planning process.
Well, good answer. I'll kind of lead off. So the strategic planning process is continuing, and since Ann is here, and she's more or less our de facto leader internally, I'm going to cede my time to Ann, unless Supervisor Haschak has something he wants to say initially.
No, I'm good to move on.
Process is continuing, and since Ann is here, and she's more or less our de facto leader internally,
Hi, good morning, everyone. Ann Woolgard with the assignment through the CEO's office to assist with the strategic planning process. I'm actually expecting one of the two facilitators, BJ Bischoff, and I wonder if we're not having a problem with the connection or something. I don't see her. I am trying to text. Maybe I could ask the chair if you wouldn't mind taking a different item.
Sure. Let's see. Let's go instead to 5B. And that is the proposal by the acting auditor to hire the previous auditor as an extra help employee.
Atlas, do we have Shamice Covison on the line?
Yes, we're in the process of pulling her in. It just takes a moment to transfer from attendee to panelist.
Good morning, Chair Jurdy, members of the board. This is Shamice Covison, the Acting Auditor Controller. So the item today is a request to bring back the retired Auditor Controller Lloyd Weer to assist with some key functions in the auditor's office. With his long-term historical knowledge, he would be a key participant in assisting with the current audit with the outside audit firm, the preparation of the county's annual financial statements, and the preparation of the cost allocation plan, as well as some consulting assistance with the fairly major munis financial system upgrade that we're in the middle of right now. This is not a request for him to come back with a substantial number of hours. It's a request to have him be able to come back for some key pieces that we need his assistance on.
Okay, Supervisor McGordy.
So Shamice, how many hours are we talking about, and what's the expense anticipated?
I don't anticipate it to be more than approximately $12,000, but and I can't say exactly how many hours, but we are, like I said, we do have some major tasks going on right now. So my guess is that it'd probably be in the range of, maybe 10 hours a week, depending on how much we're actually doing and which project we're working on. But, he is also retired and has indicated he intends to enjoy his retirement. So, I can't expect that he will be at my every need at the moment.
So I understand this kind of bridge backfill because a lot of organizations do that, including University of California. I'm emeritus, but in my case, I donate my time. Sometimes I do give special assignments to people when they have critical needs. So I'm not against that. It's important to keep the mission going, I guess is what I'm saying. So I'm supportive of expertise that we don't have internally, but we still continue to need. And if Auditor Ware, retired, is willing to help out, that's probably a good thing.
Supervisor Williams.
Would Lloyd help close the books?
The books are closed,
Sure. So this is just special projects?
correct?
So, Ms. Covison, as you know, state law requires that county employees or public employees who retire cannot go back to work for their agency within the first, I think it's 6 months, unless there's at a public meeting, the governing board votes to basically suspend or override that state law. So I assume that you and Mr. Weer discussed his retirement for some time. You've been the assistant auditor for several years. Did something come up that was unanticipated that caused you to want to ask the board to suspend this state law?
I would imagine that no matter which auditor and which time of year they tended to retire, there's always key critical functions that come up during the year. He actually indicated to me he would have liked to have retired in January, and I asked him to stay as much as he could through fiscal year end close because I didn't want to have that break in service at such a key critical time. It was right as we were going into budget, and I also knew that fiscal year end close in the middle of the property tax conversion was going to be a challenging prospect for our office to overcome. And so I actually asked him to stay as long as he was willing to. So, I don't think it's reasonable to expect that anybody in this office, I have been in this office for 3 years, but, he's been with the county for over 30 years, and there's an incredible amount of information and knowledge that is key. So in order to be able to meet the deadlines of this office and not put the county in jeopardizing any funding streams that may be coming in or having any issues with being able to issue the financial statements on time, I felt it was in the county's best interest to try to take advantage of his willingness to continue to provide assistance after his retirement. You have to remember that it's required if he's going to be, accessing the finance system or assisting me with email, or maybe he's even willing to work from home without needing to come into the office. We need to have that as an official role on the books. And I just felt that was the best way to move forward. Each retiring auditor in the past has also been willing to do that and has been brought back as extra help as an interim transition period.
So are you indicating you think that's a good practice, even though it's in contrary to state law?
Well, I think that it really depends on the role and the particular, function that person may have served. It's not always possible to do all training right before somebody retires. There may be certain things in a business process that aren't possible to do in certain times, within the time frame of an operation. So certain things are filed only certain times of the year with certain information provided. So it would be ideal, I'm sure, to have somebody in an office have 20 years with that, retiring auditor before they are in the position of taking over the responsibility, but that's not always possible in today's day.
Supervisor Hashak?
Thank you, Chair Jurdy. I appreciate Lloyd Weir's service to the county, almost 30 years. And I know that there are certain situations that, you probably, Jamise, you need the expertise that Lloyd presents and has and experience. I guess I have a problem with a person who is elected for a term and then doesn't fill out that term, retires and then wants to, or is asked to come back and fill out that more of that term in his retirement. And so it's just, it's problematic to me as a practice. And I guess it's happened before with previous auditors, but I don't think it's the best practice for anyone to be in. I think that if we're elected to a position, we fill out that term.
I can appreciate that perspective, but I have no control over when the incumbent decides to retire. And, frankly, the inability to hire additional positions in this office, I think it's important for the county to be able to take advantage of that service that he is willing to continue to provide on a limited basis in order to function and not paralyze this office in its future.
Understood. Thank you.
Supervisor Williams?
There are a few state laws I would like to suspend. This is not one. But I would like to get a better understanding of the consequence. If we say no, what is the consequence to the county? What do we lose?
I can't predict exactly what the consequence will be, but I can tell you that we are trying to keep the audit on process. But if we don't issue the financial statements timely and we don't get them to the state on time, it will impact our ability to receive state and federal funds.
And
so there are requirements that we provide that information.
Shamice, what would you say the risk level is? What's the likelihood of that happening as it stands today without Lloyd's help?
Fairly high.
Okay, Supervisor McGordy.
So I'm very comfortable with people coming back after retirement. It happens all the time in the education world because they have certain expertise that's really worthwhile. But I think what we're concerned about is just sort of an open-ended agreement. So perhaps what we need is a scope of work, specific task, and a dollar amount set to it so that we feel a little more comfortable. As a practice in the public sector, evidently it's not encouraged. I mean, that's what I'm hearing with the state laws and such, unless we override it. But I would be willing to support that if we have a defined scope of work and kind of a salary cap that we're willing to pay. Clearly, Auditor Weer is very experienced, knows exactly what to do, and we're not going to probably get that out of any other arrangement in quick order. And I suspect it would be pretty cost effective if the amount of money that Shamice is indicating.
Okay, do we have any public comment on this agenda item?
No, we do not.
All right.
Mr. Chair, if I may.
Go ahead.
I don't know if this is going to help or not, but to speak to Supervisor McGordy's point, I would just note that there have been some existing caps in place for retired annuitants as to the maximum number of hours worked per year. I believe it's in the 900s. I don't have the figure right in front of me, but there are some existing limitations that would be in place in this instance. I don't know if you're looking for something a little bit more definite, but I thought I'd let you know.
In County Council, that has to do with someone, if they work above that, then they are, I think it impacts their pension payments. Isn't that correct?
That is correct, yes.
So that's a pretty high limit that's been set by state. Supervisor Mulhern?
Thank you, Mr. Chair. $12,000 to bring Mr. Weer back to make sure that we can have monthly budget reporting and get through our audit and all of these things is doesn't seem like a lot of money for what we need to do. I don't think we could hire a consultant or a contractor for that. And as we discuss what to do about it through the strategic planning about the possible Department of Finance or however we decide to move forward with our financial reporting as a county, I'm willing to support this today. But this really does highlight a lack of succession planning that the County of Mendocino has. And it's not just this office, it's multiple offices in the executive office. So I hope that as we discuss the strategic plan, we really look at our priorities and making sure that people are trained before somebody retires. I think it's incredibly important that we're prepared for these types of career changes. And of course, you never know when somebody might win the lottery and move to Tahiti. So we should also be prepared if somebody were not even planning a retirement, but was suddenly not in an office. I think it's incredibly important.
Okay, Supervisor Williams?
Are you referring to the CEO?
We have multiple department heads that are have served our county for many decades and are nearing retirement age. I would like us to be prepared for that.
I agree with that. And I heard something about monthly budget reports for this $12,000. Will we get monthly budget reports? That definitely sweetens the deal in my mind.
I can't say whether you're going to get monthly budget reports for the $12,000. Those are not related They're not tied together. I mean, frankly, it's quite challenging to envision how you expect this office to function when I'm not able to hire an assistant auditor because of the position that we are in now. And we're now discussing the fact that we need to bring Mr. Weer back on the books. He's not indicated that he intends to draw a large salary. He needs, it's a formality to have him on the books for liability and insurance reasons, that he needs to be in the system on the books to be able to provide the assistance that our office needs. So I understand the perspective, but it is not my decision when somebody retires. It's not my decision that there's a pandemic. It was not my decision that we implemented the property tax system over the last 2 years. It was not my decision that we're doing a major finance system upgrade right now. But those are the challenges of this office right now. So if you would like to have the best possible outcome for those major initiatives out of this office, I need your support. Because if I don't have the support, I'm not quite sure how all of those initiatives are going to pan out over the next 16 months.
One last question. Since Lloyd retired, has he continued working, or has?
Yes, he has.
As a paid or a volunteer?
Volunteer. And he has been asked to fill out paperwork as a volunteer with the county.
Okay, Supervisor McGordy.
So I would move that we retain retired Auditor Weer on a limited appointment with a defined scope of work and salary cap, so that we can assist the auditor's office in completing the necessary tasks that are required by law.
Supervisor Hashtag.
I'll second that. I'm not happy with this process. I think that Supervisor McGordy, you brought up about educators coming back, but I think this is different because it is there's a term that a person was elected to, and I think that should be honored. But since we're in this predicament, I think that this is probably the most cost-effective way to get this job done.
I agree with you.
I second.
Okay, Supervisor Williams.
Yeah, so I'm still back on. I appreciate that Lloyd is still giving to the county. So no disrespect for the effort, but I'm not clear on in what capacity he's currently working for us, because I don't think he's technically a volunteer with the county, and I don't think we're paying him. So what
He's
is
not presently doing anything for the county at the moment, but we are in the middle of a financial audit. We have tasks that we are required to perform right now. So we are in suspense. We are suspending at the moment tasks that require his assistance.
Understood. Is it possible for HR or the executive office to explain to us the current working arrangement with Mr. Weer since he officially left the county?
Darcy, and there goes Carmel. Go ahead, Carmel.
Well, Chair Jurdy, through the chair to Supervisor Williams' question, I don't have an answer to that. I think that if you're asking what is Mr. Weir's relationship to the county right now, my last information was that Lloyd retired. So, I think that Ms. Covison is in a tough spot here. And so I'm not quite sure what is happening with Lloyd today. I don't know when he's worked, when he hasn't worked. I can't answer those questions. I know that we were waiting for Lloyd to assist with closing the books for the year, and the books are closed. I don't know if Shamice did that. I don't know if Lloyd helped. So I don't have an answer, and I'll refer to Darcy Antle if she has anything to
Darcy Antle, Assistant CEO. We are bringing in HR Director William Schertz at the moment. There's William.
Yes, good morning, Human Resources Director William Schertz. I am currently following up with my staff to see if Mr. Weer has filled out the paperwork. he could either go directly with NCO to fill that out or come through HR. So I'm having my staff follow up right now.
But William, he hasn't, it doesn't sound like he's yet gone through that process, and yet we heard he's volunteering. What does that mean?
Well, quite frankly, that means that he's been working for the county, but not authorized to work for the county.
Mr. Weer has been responding to my telephone calls and phone conversations. He's come into the office to assist me with information. We had critical CARES Act information that was due to be reported to the feds last week. He did need to come in and help me locate that supporting documentation in order to provide it. He did provide me with assistance in closing the fiscal year end process. He did not walk out the door and not come back. He has assisted me, but he is not coming in on a regular basis. But it was critical that we get the year end closed because it impacts other outside agencies and their processes as well. So he did assist me with getting the fiscal year end closed. That is unpaid. That's time he donated to me and the county in order to get us to this point because it was critical. He is no longer functioning in any capacity at the moment. We were hoping this item was going to come back at the September 14th meeting. That was the meeting I requested it to come forward to, so that this wouldn't have been an issue. But it was critical that we got the fiscal year end closed. So at this point, he is not working for the county. He still responds to my text messages of inquiry when I need assistance, but we will need him in a greater capacity than what he is doing right now.
Okay, Supervisor Hashak.
Thank you, Chair Jurdy. I call the question.
Okay, can we have a roll call?
Yes, this is Atlas Pearson, Deputy Clerk of the Board. Things that Supervisor McGorty did add some language in there. I just want to clarify, was the motion the recommended action as it's written?
It is with the amendment that we have a kind of a very brief scope of work and you know, kind of a financial cap of how much we're going to spend.
I think it's listed in there as $12,000.
Okay, Supervisor Williams.
I would like clarity on the motion. I hear Supervisor McGorty asking something to come back. Will that come back first? Or are you passing the recommended action and putting some constraints on it? I'm not clear what the motion is.
It would be the recommended action with some constraints.
What are those constraints?
A financial cap, and then also a kind of a defined plan of work.
Are you expecting the supervisors to see that defined plan of work before it's implemented?
Yes.
So the action is not the recommended action. It's for this item to come back with more detail.
Well, I don't want to hold this up either. So if we can put this to a responsible party such as Williams Shop to, you know, verify that we have the cap and we also have the plan of work, that would be acceptable to me.
I know there's Supervisor Hashak asked that we call the question, but would it be possible to ask County Counsel to advise us?
If I may, Mr. Chair, I think the confusion is stemming over whether or not this is going to be, there to be some sort of specification of the cap and scope of work here. You know, if the board wants, you know, one thing that you could do is simply, you know, ask maybe the auditor's office to just come up with a number and just a very brief description of work, and we could come back in the afternoon and incorporate that in the text of any motion if that works for the board.
Works for me.
Okay, Supervisor Hashak, will it come back in the afternoon?
Yeah, that would be fine.
Okay, Supervisor Moore.
Thank you, Mr. Chair. I was actually gonna, because it's listed as $12,000 already on our agenda summary, I was going to suggest that we move forward and that the next CEO report include a scope of work and the projects that Mr. Weer will specifically be working on so that we can move forward. If Ms. Covison is able to bring that back this afternoon, then that's fine. I just have an alternative suggestion.
The projects are listed in the agenda item. He will not be able to work more than 960 hours or it will impact his retirement.
It is 960 hours wouldn't be total to 12,000 though.
Well, that's over a 12-month period.
Correct. So I think it would be helpful for the board to understand how many hours per month, and specifically on which project those hours would be spent.
With all due respect, I don't think I can specify exactly that at this moment. We are attempting to hire to fill critical needs in this office. And if I'm not able to hire those needs, I might need additional consult from him for certain items. I don't quite understand why this is such a critical one. We know we're already 2 full-time positions down in this office, and I'm asking for him to be able to be on the books so that he's allowed to be in the building or we're working remotely and accessing the finance system to provide assistance as requested.
Okay, so this is going to come back in the afternoon, and we can have more details. Okay, that takes us to item, see, that brings us to item 5E, which is approval of up to $240,000 per year for a period of 4 years for the operations of the crisis respite services on the coast.
Atlas, do we have Dr. Janine Miller on the line?
Yes, we're currently bringing her in.
Okay, great. Okay, thank you. Thank you, Chair Jordy.
And wait, I should actually ask, Ann Mulgard, was she able to bring the consultant in on the strategic planning?
They will be joining at 1:30 due to a time constraint on the behalf of the consultant.
Okay. Okay. All right. Okay. All right.
All right, good morning, Dr. Janine Miller, Behavioral Health Director for Mendocino County. I have in front of you today an item that went to the Measure B committee at our August meeting, and it was brought forward by the City of Fort Bragg Homeless Ad Hoc Committee. There was a request to use Measure B funds in the amount of $240,000 a year to allow the City of Fort Bragg to work with Redwood Community Services to build a crisis respite center in the Fort Bragg area to make sure that all coastal residents had an option for crisis respite and didn't have to travel to Ukiah area to get those services. This was supported by the Measure B committee. It is also supported by the City of Fort Bragg Police Department. So there's a lot of support for this item to move forward. We are asking for the $240,000 so that we are able to house all individuals at that facility. This will allow us to cover the cost for individuals that do not have insurance. For private insurance individuals where the private insurance will not pay for this level of care, and then also to have matching funds so that we are able to bill Medi-Cal for those individuals that do have Medi-Cal. So this is not the full cost of it. We are hoping to be able to fund the remaining cost to run it through Medi-Cal billing, but we are requesting $240,000 of Measure B funds to go towards this facility. And for a 4-year period, they will be looking for additional grant opportunities and funding so that we can make sure this will continue past the 4-year period. And so I know that the city, RCS, and behavioral health will be working to really make sure that we can come up with some alternative funding or ways to fund this so it continues past the 4-year period, because it is definitely a needed service in the Fort Bragg area. We have one here in the inland area, and it has worked very successfully in reducing the number of individuals that need to go out of area to get hospitalized. So if there are any questions, I'm happy to take those.
Okay, thank you. Supervisor Hashak.
Thank you, Chair Jordy. Dr. Miller, could you explain the difference between the crisis respite services and the CRT, the Crisis Residential Treatment Center? Are there beds there? What's it look like?
Yeah, so they look kind of similar. A crisis respite is more, it's a bed. They have beds It's sort of similar to a CRT, sort of similar to a CSU. It's kind of the middle ground between the both of them. You generally are not allowed to have someone on a 5150 hold at these facilities. So it's not a place to hold someone. Like a CSU would be the level of where someone is on a hold and you're looking to do a treatment to see whether or not they need to advance to that higher level of care, and then determining within 24 hours, are you able to stabilize them, or do you need to then move them to that higher level of care? Crisis residential is also for someone who's not on a hold, but it's more of a long term. So it's more of a 30-day stay where you're looking at someone who needs to be stabilized long term. It gives them about 30 days to transition back into their community. Crisis respite is in the middle of that. It's not a licensed or certified facility. A CSU and a CRT are required to be licensed and certified through the Department of Healthcare Services and the CCL. But with the crisis respite, it's kind of like the person isn't meeting 5150 criteria, but they really can't safely go home. It gives them a couple days of somewhere to go, kind of get some services, and help to transition back into their community, help get connected to services. So it's an intermediary between the different services we have, and it has been very effective to moving people out of the ER quicker because you can give them somewhere to go, so you can resend that 5150, and it has definitely benefited the inland area.
And how many beds would there be?
I think they're looking at 4 to 6 right now.
Okay, Supervisor McGordy.
Dr. Miller, I'm very supportive of this because when people are having a crisis, they need to be seen and cared for right away. And adding another hour and a half onto their misery to transport them to Ukiah really doesn't make a lot of sense in my thinking. And I support this move. Where physically do you think it would be located? Is that to be determined?
So they have an opportunity right now. They're working with Coast Hospital. There is a building there on the Coast Hospital campus that currently has an existing 2-bedroom suite. So they're looking to remodel it for at least 4 patients, and possibly could expand it to 6. So there is a facility that has already been identified at this point, and they're working to make sure they can definitely secure it and make that. So they sort of have a facility in mind right now.
That's even better because then you have an emergency room obviously available if someone starts having a deepening crisis or starts to decompensate.
Yeah, Supervisor Williams.
It's cost effective. It's in line with the tax voters passed. I think the public wants us to support this. I certainly support it.
Okay. I know that we have some people who, or at least one person who's been trying to get in, is Mayor Bernie Norvell from the city of Fort Bragg. Has he been able to log into the meeting yet?
We did receive a telecomment request and we sent out the information, but he is not yet on the line.
Okay. Okay. Well, we do have support here from the Chief of Police, City of Fort Bragg, and the Measure B Committee. Okay, right. Well, he just texted me that it says that he's in the meeting.
Is he joining from an alternate account? We're not seeing his name.
He dialed into the phone number, 888-544.
Do not currently have anybody in. Let me double check.
I see a total of 1 phone call in.
The one phone call in that you're seeing is Deputy CEO Judy Morris, and now Bernie Norvell has joined. Mr. Norvell, you can begin when you're ready.
Thank you, sir. Good afternoon, Chair Jurdy and supervisors. Thank you for the opportunity to speak and for considering this item here today. I feel our letter of request to Measure B summarizes the need for crisis services here on the coast, and the letter of support from our ad hoc committee and our chief of police summarizes our support. What is not included in those documents, but of equal importance, is a clear understanding on our behalf of the responsibilities that come with the request for funds of this size. It is important to me that you know that we have this understanding, that we do not take this request lightly. We already have in place a mechanism for tracking these kinds of calls, which gives us a baseline for where we are today. If this service is funded, we plan to report back annually to the supervisors to update you on our success. Success, in my opinion, is fewer clients occupying beds in our ER, fewer calls for service with our PD, and most importantly, our clients utilizing the service and staying out of crisis. Lastly, I'd like to share our reasoning behind the request for RCS to be the service provider. Over the last 2 years, our city has worked extensively with RCS to resolve our issues that evolve around mental health and crisis. RCS has been more than willing to hear us out and support us in our ideas, offering us a professional view into this service and working with our PD to take a progressive approach to better serve our community and its clients. To be clear, I reached out to RCS and asked for this help. I asked them to contribute to the process and to be part of the solution, for which I am happy to say they have done so and continue to do. My concern around putting this out for an RFP and the possibility of awarding it to another agency is the added barrier that another provider could pose to the process of serving these clients. We need to work on improving the continuum of care, not add to the already encumbering process. Again, thank you for this opportunity here today and for all you do. With that, I'm happy to answer any questions that you may have.
Okay, Mayor Norvell, not seeing any questions at the moment. So thanks for your comments.
Thank you, sir.
Supervisor Hashek?
Yeah, thank you, Chair Jurdy. I'll move the recommended action. I know that Measure B committee is behind it and Fort Bragg and everyone else. So let's get moving on it.
Second.
Okay, we have a motion and second. And I believe that was the only public comment we had on this item by video or telecomment today. Okay. All right, can we have a roll call?
Supervisor Hashak?
Yes.
Supervisor Mulhern?
Yes.
Chair Jurdy?
Yes.
Supervisor McGordy?
Yes.
And Supervisor Williams?
Yes.
The motion carries unanimously.
Okay. Let's see. Said we had, so looking at the clerk of the board's office, we've kind of moved around the afternoon items. Which item is ready to go next?
Item 5F.
Okay. 5F, which is the Behavioral Health Recovery Services Status Report Activities. Dr. Miller?
One moment, we're pulling her back in.
Sorry, I had to get back in as a panelist. Dr. Janine Miller, Behavioral Health Director. So wanted to give you guys an update on sort of where we are with Measure B. We have been trying to do regular updates in the CEO report. So we haven't been back in front of the board for a couple months as we've been really putting it within the CEO report. But I wanted to go ahead and do an update just to kind of fill in where we're at and answer any questions you may have on what's happening with Measure B. Quickly, in the report, we provided the crisis residential treatment facility is moving forward. We are hopeful to have it completed by the first week of November at the latest. The project is really coming along. It looks great. We have landscaping going in this week. And we included a couple pictures of sort of what it looked like the last time we took pictures. So really excited about that. We are working with the provider Redwood Community Services to get licensed so we can actually start serving individuals in that crisis residential treatment facility. We're really excited that this is almost completed and we'll be able to start serving clients soon. We will be doing a grand opening and we will make sure everyone is invited. We've also had requests from the state. Several people at the state have asked to also be included in our grand opening. They really are excited to see that Mendo was able to pull this project off and build the facility. Our mobile crisis and response team, we have one team that has been going out with the sheriff. It's been a great experience. The sheriff's department is very happy with this. We continue to recruit. We did a recent recruitment. We are waiting. We heard that we have a decent number of candidates. We have struggled with getting qualified candidates for this position. And so we have been working with the sheriff to look at different recruitment opportunities. There's a lot of people that want to work for the sheriff's office but not be a deputy. So we're looking at how we can maybe work that into working on the mental health side as a mental health rehab specialist. So we do have a recruitment that just closed. We heard there's a number of candidates. So fingers crossed, we're really excited and hopeful that we will get some good candidates out of this last recruitment. And then we are moving forward with some recruitment efforts with the sheriff's office to encourage additional individuals who might be interested to apply. We went forward with the contract with NAMI to work on our community education awareness and support services in our community. That contract, as you know, is signed and NAMI is moving forward. They are in the process of recruiting for an executive director to come in and really get this program off the ground and work with local organizations and really get education awareness and stigma material out there, do some training. So we're really excited about that. Their recruitment has been out for, I think, 2 weeks now, and they have got a decent amount of candidates. I checked in last night just to see how that recruitment was going, and I think they had up to 15 plus candidates applying for that position, and they still have a little bit more time before they look at it, do interviews. So really exciting news for them. The Behavioral Health Regional Training Center, we have a couple minor things left for the contractor to finish. They're going to be out there this week trying to finalize the last things. It's really, from the inside, it's really ready to go. There's a couple minor outside things we need to do, and they need to finish installing the requirements so that we could put a generator out there in an emergency. So that's where we're at with that. We still do have at this time the crisis support center out there. So we are working around them finishing construction and having individuals at the facility for services. The psychiatric health facility, we are still in the process of doing the feasibility study. We are hopeful that in January we will come forward with that feasibility study. We have been working with Knox and Lewis, county facilities. Telecare has been at the table with us, which is who we had chosen as an operator, and they bring a lot of years of experience with them. So it's been really wonderful to have them being willing to work with the team and talk about what their experience is with the rest of the group. And so hopefully you will see that feasibility study in January with details of what options we have out there. It does look like we do not have to get OSHPD approval on our facility. We'll be meeting with county council to verify that that is 100% based on what we're hearing from OSHPD, and then we'll move forward. But that does open up some different opportunities and abilities to construct the facility quicker than if we had to go through OSHPD requirements. The crisis assessment and psychiatric hospital aftercare, they've continued to see clients as of July 1st, all clients that don't have Medi-Cal who need aftercare services are getting those services now. And so it's definitely been a benefit. It's offered to everybody. And they have started and will continue to provide those services to everybody. We do have a contract that we're finalizing to do the Mental Health Treatment Act audit. We're using the same company that we use with the auditor's office used. They were willing to work with us and able to do that audit for us. And so they will be looking at 3 years to start. We can definitely have them do more years, but they're going to start with the 3 years, and that will cost about $6,000 for them to do that and get us those audit results and get it to the committee. And I am happy to answer any questions you guys may have. Also attached to the report is just our is the financials. Wanted to make sure you guys could see the financials. These are given out to Measure B monthly. Well, every other month now that we've changed our meeting schedule. It really allows us to track the expenditures of Measure B, what we're spending in regards to the Knockton Lewis contract, and any of the projects we have going on.
Okay, thank you. Supervisor Mulhern.
Thank you, Mr. Chair. Thank you, Dr. Miller, for including the attachments that you included with the financial information. It would be very helpful to me if those could also be uploaded to the website, and that the website can be updated with the current summary. It's really a useful tool when people are asking questions about the money that's been spent. And I appreciate all of the work that's moving forward. It seems like we went from not much happening to a real freight train of activity. So thank you very much for you and your staff for making all of these projects move forward.
Okay. Supervisor Hashak.
Thank you, Chair Jurdy. With the CRT, you know, the amount budgeted for the contractor was 3.134 million, and we paid out 1.471. Are we on track with that? Or how do you think it's coming in?
So yeah, I don't want to jinx us or anything, but we are on track. At this point, we will come in at budget or under budget. We made some changes from the original plan that sort of reduced some of the costs, but of course, you know, costs with COVID have gone up. But we, at this point, we do not see that we will go over budget.
That's good news. And just one more follow-up question. With the feasibility study for the PUF, you know, you're saying it will come in January. And is that going to be a real comprehensive feasibility study? It seems like it's taking quite a while to do. So what will we have in January?
So I'm going to tell you what I think. I'm not an expert at feasibility studies. So based on what I understand, it is a comprehensive feasibility study. They will give you recommendations on if you used Whitmore versus if you didn't use Whitmore, the cost. What if we remodeled Whitmore versus what if we build from scratch? They're looking to see if there's any flood issues. Would we have to raise the building? So really looking at that whole thing. If we changed the entrance to State Street instead of Whitmore, they're really looking at traffic control, flood, cost to renovate versus build from scratch, and then looking at using that site versus another site. So I think it's going to be very comprehensive. They are working with the provider who's really saying this is what we need for a PUF, so that it's really to scale of what Telecare currently does today, what they have in their current PUFs, to really say this is what we really need and what that looks like.
Okay, thank you.
Do we have any public comments in this agenda item?
No, we do not.
Okay. All right. Well, thank you for the report and the update.
Move the recommended action to accept.
Second.
Okay, got a motion and a second. Can we have a roll call?
Okay, so I just want to clarify, we moved the recommended action. Was there any direction provided?
No.
Supervisor Mulhern?
Yes.
Chair Jurdy?
Yes.
Supervisor Hashak?
Yes.
Supervisor Williams?
Yes.
And Supervisor McGordy?
Yes.
The motion carries unanimously.
Okay. Well, I've been informed by the clerk of the board that we've got one more item that could be heard before we go into closed session, and that's item 5D, which is the healthcare plan.
We're in the process of bringing in the panelists for this item.
Chair Jurdy, this is CEO Angelo. So as we wait for our presenters to get on, so after closed session, after lunch, when the board gets back, you have the strategic plan at 1:30. That is when our consultant will be available. And then you have 5C, which is the jail project. Other than that, Chair Jurdy, there is no CEO report today. And then, of course, you have supervisor reports. But I think we have a manageable afternoon once we get through closed session. Thank you.
Thank you. Okay, it looks like we have the healthcare plan team in the meeting now.
Yes, good morning. I'm Chair Jurdy, members of the board, CEO Angelo, and County Counsel Curtis, Sherry Johnson, Deputy CEO. We are here today to have a presentation by Keenan Associates and discussion on the county's self-funded health plan. We are recommending an increase, as you will hear in the presentation. Our health plan has had a significant increase, resulting in the deficit in the health trust fund. So today with me, I have Peter McNamara, who's the senior consultant with Keenan, Michael Ahn, who's the underwriting consultant with Keenan, Emma Saucedo, who is our principal analyst and oversight of the daily health benefit plan, and also Katie Ford with Human Resources, who is our wellness coordinator. So we do have a PowerPoint, and I will go ahead and share my screen. And I'm going to turn it over to Michael Ahn to do the presentation.
Thank you, Sherry. Peter, I think, would you like to start off the meeting and give
Sure.
background?
Sure. So as Sherry indicated, I'm Peter McNamara with Keenan. I just want to take 2 minutes to kind of give you members of the Board of Supervisors a little bit of history as to how we got to where we are. As you know, your plan provides coverage, excuse me, for medical, dental, and vision. The medical includes your prescription drugs, and the program is funded 75% by the county and 25% by employees. Once that premium is developed, from roughly 2010 to 2021. The board has approved changes from minus 15% to above 15%. In about 2011, the county asked us to work with them to figure a way to level off the increases, because prior to us coming on board, you were having increases up and down as drastic as I just mentioned. So in 2013, we recommended a move to the Anthem JAA network, which immediately saved the county about $1.5 million a year. We also moved to the KPPC RX prescription drug program. As an aside, in 2013, your prescription drug cost was $1.8 million. That was reduced by 20% a year, and your prescription drug cost last year just got back up to $1.8 million. So the program to control cost was working quite well. In December 2014 through December 2017, the board approved 0 increases. Now that's important because when Michael shares with you some of the tables, healthcare inflation increased greater than 0 over that period of time. We did, however, up until 2018, have a significant reserve, or what I'll call excess reserve, in the trust fund. And then we can see why that was reduced. In 2017, the board approved a 3-month premium holiday for employees that would take effect in October, November, and December of the 2018 plan year. The plan year runs from January through December. In December of 2018, the board again approved a 0 increase for 2019 and an additional 3-month premium holiday. So what that means is you were reducing the level of your excess surplus with each month of premium holiday. In April 2020, 2020, the board approved a 3% increase. November of 2020, we implemented a clinical pharmacy or a pharmacy clinical management program, in large part because during the 2019 plan year, it became evident that your specialty drug costs were starting to skyrocket. And the pharmacy clinical management program will help to control those costs. In January of 2021, you moved to the Anthem directly as an administrative services only program. So now there's no wait time between the time claims are paid by Anthem and the time you get them. There's no middleman like you had with Delta Health Systems. Sherry, if you would go to page 5, table 1. This is the history of what your renewals have looked like and what you have approved since 2011. It shows a 1% per year. If you go to table 2, which I believe is on page 6, this shows you the difference between what you have approved and the increases at 1% a year, which is the red line, and healthcare inflation during that same period of time. Now, while you had a significant excess reserve, this was not an issue. But when that excess reserve began to get depleted, then it became of some concern. So, Michael, I'm going to turn it over to you and let you kind of walk through some of the numbers.
Thank you, Peter. Just following through the comments made by Peter on table 2 on page 6 there. The comparison there is over a period of 10 years, going back all the way to 2011, we're looking at average of renewal of 1% each year. And the cumulative effect of that is about 12% at the end of 2021. And it's a compounding effect of the interest rate of 1% increases. The comparison to the average healthcare inflation costs over the years is around 8%. Healthcare trend is around 8% per year. And some may even argue that's at the lower end. Some areas in Northern California has much higher. They may have seen a 10 to 12% healthcare increases over that period of time. So the difference in after a 10-year period of time from 2011 to 2021 is approximately 233% versus 112% difference in the basic cost unit of healthcare expenses. And these are the expenses that a normal employee at county would go see for provider services or healthcare services at hospital. And every year, providers and hospitals are negotiating for their increase. And so this is the cumulative difference. And as Peter mentioned, we made some significant changes over a period of time that really were able to keep the costs down on the self-funded plan and really pass on the savings to our employees, to county employees and the county itself to achieve the savings so that the 233% increase there you see is minimized and mitigated to the county employees. Moving on to page 7, table 3, that is the fiscal year basis. The county is on 7/1 to June 30th fiscal year period. So we are looking at that table, the fiscal year differences trending all the way back to July 2011, all the way up to June 30th, 2021, past 10 fiscal year policy periods. And as you can see, these are per employee per month cost basis. And as you can see, there has been steady increases over time of per unit employee cost per month, especially in the recent period. And this is due to some of the compounding effects of the healthcare cost at the latter years that we're really seeing the effect of it. And also our ghost explain a little later on what really the cause of it is in 2019 and 2021, those years. But as you can see, as Peter mentioned, in 2013 and 14, we made significant change, which is the Anthem network that negotiated for counties self-funded providers. In that network, in 2013 and 14 policy periods, you can see jumping significantly down, and we were able to keep that cost down all the way up to approximately 2017, where the cost was $862 per employee per month. Going back to 2013, it was $850. So there was absolutely no inflation at that time for the county. And that network change and the KPPC, the pharmacy program that we put in place, really were able to keep the cost down for the county and maintain that through that period of time. Moving to table 4 on page 8, there we actually showed the calendar year basis versus the fiscal year basis of the total paid claims for the medical and prescription drugs. And these are the entirety of the claims cost that the county incurs for their employees over this period of time. And as you can see, in 2013, we were at 8.3. We had a slight blimp up on 2014. However, we came down again and were able to maintain that cost all the way up to 2017. However, as shown previously on the cumulative effect of healthcare trend, it's now catching up to the county health plan. We were through this 2011-2021, we're keeping in mind we only had a 1% increase to the county health plan on average, while the healthcare trend is increasing 8% per year. Skipping over to, I think the good place to go is the table 5, page 10. And that table shows the average enrollment and medical prescription drugs. It's a dot plot through the years going back to 2018. And you can see we're averaging about slightly over 1,000 monthly employees, very consistent employee count. However, starting in 2019 or so, we're seeing blimp up above the average of what we see on the red dot plans. And that continues on throughout 2021. We're in the high end of $1,500 per month per employee. And I'll explain shortly the reason for the latter increase in 2021 as well. Skipping over table 6, page 11. This shows what the large claims cost to the employee health plan, the effect of that is. And what happened during the past couple of years in 2019 and 2020, we had significant increase in large claimants come through our plan. What happened to that is just a couple individuals have incurred over 20 to 25% of the entire healthcare cost for the 1,000 employees. And this type of events do occur in group health plans, and they occur seasonally over time. But the impact of these couple of claimants, as you can see in 2020, we had 15 million in total claims come through from the entire 1,000 employee groups. However, 4 large claimants incurred 3.2 million in claims by themselves, which is approximately 22%. Prior years, that number was much lower from the large claimants. If you look at 2015, we had 8.1 million in claims for the entire population, but only 311 large claimants came through. So for the county, the last 2 years, specifically 2020 and 2019, the large claimants had significant impact to the performance of the overall plan. Table 7 is page 12, is the overall healthcare plan cost sharing between the county employees and the county itself. And what we want to show there is the overall effect, trend of the cost sharing differences. And we want to see how they deviate from the 75% county contribution target versus the employee 25% contribution target that we have in place. And so over a period of time, as you can see, especially the last 2 years, the county's contribution has jumped up tremendously to 83%, and the employee contribution have decreased to 70%, meaning county is now contributing much more than the 75% target we have. Now, in the early years, going back all the way to 2011, when in 2012 and 13, when the plan was running well, we had the formula was vice versa. We had employees contributing slightly more than the 25% target, and the employees county contributing a little less than 75% target. So for instance, if you look at 2013, the county was contributing 72%, and the employees were contributing 28% of the overall health plan cost. The effect here is that, as shown earlier, the healthcare trend inflation is catching up to the plan. And also the last 2 years, those large claimants have really significantly affected the health plan, where now county is really contributing much more. Over to page 13, table 8. In 2017 and 18, when the plan was running so well, and we were having excessive amount of creating surplus in the health fund, we recommended premium holidays for employees. And those premium holidays were 3 months premium holidays taken for the employees in 2017 and 18. And at that same time, the county itself took 3 months premium holidays. In those two periods of 2017 and 18 totaled slightly over $4 million in total premium holidays that were taken by the employees and the county itself. Our recommendation was that the premium holidays were to be passed on only to the employees, because it's their plan, it's their performance, they're doing well, we're passing on the savings to them. Had the employees only taken the premium holidays those 2 years, we will be taking only $1 million out of the fund from those premium holidays. I think the good skip over page 14 and 15 and 16 are just our projections of your total claims and expenses for 2022. We're expecting about 18.2 million. Skipping over to Exhibit 2 on page 16, the table there shows basically at the 12% renewal increase, the projected revenue of 15.3 million versus currently we're collecting on our revenue 13.7 million in 2021 from our employee contributions and county contributions. The IBNR number there, which is abbreviation for the incurred but not reported claims, is the claims that are lagged behind because the medical and prescription drugs takes about 2 to 3 months to get actually paid out in the self-health plan. And we're calculating that to be about 2.6 million. And that is a board directed requirement for the county health plan, that we should keep at least the IBNR claims expenses and the expenses that we need to pay off those claims using an Anthem Administrative Services. We should at least have that in our fund. And that's at 2.6 million. So moving over to page 17. As mentioned, we are recommending 12% increase for 2022, and it's in general higher than what we have seen in the past. I think we want to just kind of show on that exhibit the actual dollar differences to the employees and what they will have to make out for this 12% increase. So currently, looking at most of the employees from Plan 2, there are over 95% of employees participate in Plan 2, which is the a lower benefit of the two plans. And so for single employee only individual, their current biweekly payout for Plan 2 is about $61 that they get taken out their paycheck. So looking at Plan 2, if we were to pass on the 12% increase, be mindful that county is absorbing 75% of the whole cost increase, and the employees are absorbing 25% because that's our target. That $61 will go up to about $71, or slightly under, to be exact, $9.68 will be deducted from an increase of $9.68 from the current biweekly payroll for the single employees. And so and so that just shows what the increase will be, and the county will have to increase by $29. And this is for the wellness program, and wellness program is a program that we have in place for the employees that really contribute to the effectiveness of the healthcare plan to keep the costs down. And we're encouraging all employees to participate in the wellness program. And in return, the county a credit, approximately $19 per pay period, which really helps our keep the costs down and pass on the savings. So moving on to the last page, which is our recommendation section. As I mentioned, we are recommending 12% increase. We are recommending that board maintain that we maintain the board directed requirement of IBNR expenses, which is about 2.6 million. And as I mentioned, Peter mentioned earlier, we are below that amount at this point. So I would like to conclude my presentation for any questions.
If I could add two things to what Michael was recommending. I'm sorry, Peter McNamara with Keenan again. One program that we didn't include in the PowerPoint today is you may know of it as MERP. Its name is changed to Complete Care. It's a program that allows for anyone who has a spouse with coverage to move to the spouse's coverage, and then all the county pays is the co-pays, co-insurance, and deductibles. You have 18 people who have opted for that plan, and you have saved, on average, $230,000 to $250,000 a year in premium costs, the county share in premium costs to by having that plan in place for just 18 employees. That's a significant savings as well. Thank you.
Mr. McNamara, I think you're bringing that up. I guess you're just trying to highlight that that's an option for county employees if they have a spouse that has an alternate medical plan, that they can enroll in this alternate program that the county offers. It is a benefit, and I think you're probably bringing it up because many county employees are probably unaware that medical benefit is available to them.
Correct.
Okay, Supervisor Moore.
Thank you, Mr. Chair. I myself am trying to work through the process of using the wellness plan. And I had a question about the slides, the slide deck that was included with our agenda, and I'm pretty sure the one we just saw on the screen. If the numbers are the same for the wellness credit, or if you're excluding the wellness credit. So I'm unclear as to which is which, or if it's really the same. It was a little more challenging for me to see on my screen, but in our packet, it's on the Keenan and Associates, it's page 35.
Yes, yes. That is an error in the multiple iterations that we did, we mistakenly used the same the graph. So we can correct that and get that to you by end of business today.
Oh, no, Peter, no, that is not an error.
Michael's the same.
Yes, that is not an error. Remember, because we're giving them $19 of credit for the participation of wellness credit, the county pays more for the employee cost. So if you look at 2021, let's just look at, go back to Exhibit 3. So let's look at Plan 2 employee cost only. So we show there 6144, but the county cost is $261.26. Okay, but the wellness, but that includes wellness credit. Now, if the employee does not participate in the wellness program, that individual, if you go down to the square below, the county's cost is $242.03, whereas the employee cost is $80.67, because they're not getting the $19 credit. So employee cost goes up from 61 to 80. So with the 12% increase, what happens now is we're increasing the rates by 12% overall. And that 12% gets tacked on. If we look at the wellness credit, it goes from 61 to 44. That person still receives the $19 credit. However, if the person does not participate in wellness program, that person's cost will go up from $80.67 to $90.35. It still goes up $9.68. It still goes up the same amount for the wellness credit person, $9.68. It doesn't matter. It's just the basis is much lower for the wellness credit employee versus a non-wellness participating employee. It's still the same dollar amount that goes up.
Okay, thank you for your clarification.
Yes. Thank you.
I have a couple questions. One, while we're on the wellness program, is there? We know that this overall healthcare plan has been, and the wellness program in particular, has been sort of an award-winning program. CSAC, I think, it's awarded a program, but it does seem to me that it's a little bit Byzantine and complicated for some people to participate in it. Who maybe, and so I'm just wondering, is there any way that the wellness team could kind of relook at it for 2022 and see, is there a way that they can make participation in the wellness program a little bit streamlined and simpler, and maybe maybe for 2022, make some big goals, like if you get vaccinated for the flu, you're going to get a bunch of extra points this year. You get vaccinated for the COVID, you're going to get a bunch of extra points this year. And a couple of hallmarks for 2022 that might be different from past years, and see if we can get a higher percentage of the employees to at least get that wellness discount.
So Supervisor Jody, we have with other of our clients of both similar size have been doing exactly that, modifying the wellness program to take into effect folks who are vaccinated, maybe if they're in the age group to get a booster, that they've gotten a booster, et cetera, to do all of those things and adding points. I know Katie works with the Kingdom Wellness team to develop that program. One of the things is sometimes it seems difficult because they're trying to create a program that gives as many people as possible, as many options as possible to get the points they need in order to get the credit. But we can certainly work with Katie and her team to look into reevaluating the program.
Okay, thanks. Katie, go ahead.
Hi, good morning, Chair Jordy, members of the board, CEO Angelo, Katie Ford, Acting HR Manager, Wellness Program Coordinator. So if I could just speak to that a little bit. We do try and make changes to our program every year to make it easier. We have in the past struggled with issues with our wellness vendor and the technical components making it more difficult. We did an RFP in 2019 and launched a new, much easier vendor to work with in 2020, which I think eliminates a lot of the barriers from people participating. Some of the things that we look at when we design our program, though, is we want to incentivize activities that promote long-term behavior change. So what we're trying to avoid is this, you can do two to three things over the course of 4 days and be done, and not think about wellness the other 10 months out of the year. So in order to impact claims the best that we can and impact behavior change within people for healthy behaviors, we're trying to get them to engage in the program over time continually. That being said, every year we do look at our program and try to make adjustments based on claims data or based on the issues provided by Keenan or the Keenan wellness side of things to make it easier. We have already met with the benefits team and outlined that there were some things that we could incentivize further, allow people to earn more points through, say, like preventive care exams, which is something that people kind of neglected during 2020. We are offering a COVID vaccine voucher this year, and that's a little tenuous going into next year. We're not sure what's going to happen with the booster environment, but we do have that option there. We'll be kind of boosting those points, providing more points for people to qualify through coaching. But essentially, we're looking at all those different population groups within the county. You have your clerical staff working maybe at a desk and it's easier for them. You have people who don't have access easily to a computer. So we're looking at ways for them to qualify easily as well. The short answer to my long explanation is that we continue to try to make it easier every year. We do battle the issue that if we make too many drastic changes all at once, we lose people. It's too hard for them to go from one year to the next with drastic changes. They kind of always expect that the program is very similar to what we did the year before. So we try and make those changes. We're trying to impact behavior change and better health amongst our employees. We have to do it kind of in stages.
Okay, thanks. Supervisor Hashtag.
Thank you, Chair Jordy. I appreciate that the getting a vaccination for COVID is now part of the wellness program. I think that's a good move. This is a question for Keenan, Peter, and Michael. Is that your recommendation is this 12%? And talking about a drastic change, I think a lot of employees would feel like this is a drastic change in their health benefit. To smooth out that transition, have you run the numbers on 6%, 9%, other levels of increase? And that my understanding is that it could be increased every year. So instead of doing the 12% this year, it could go up 9% or 6% or some other percent. You've worked those numbers, I'm sure.
So we have, and if you look at, take your number 6% as an example, that would not get the county to the incurred but not reported funding level that the board has mandated that you have. So you're supposed to have that as a minimum, be able to fund that. 9% wouldn't either. 12% gets you very close. Quite honestly, we've looked at 14 as well. But we believe that 12% is an appropriate increase, and that's why we typically don't do this, but we decided to look at the biweekly cost to both the county and employees, because an employee can look at that and say, okay, in my paycheck I'm getting another $9 removed or $12, versus when you look at 12%, and you look at the annual cost, that's a big number. But when you look at it on a paycheck by paycheck basis, it tends to make it a little bit easier. But we have run the numbers, and quite frankly, it's, we would defer to the board to what you choose, but we are recommending 12%.
Yeah, I think that, we're having a problem with staffing for one thing, and we've done our best to increase our salaries. And obviously this benefit is part of the overall compensation of an employee. And when you look at an employee with a family, that if their costs are going up almost $100 bi-weekly, that's a huge chunk out of their paycheck. So I just would like the board to consider that.
I have a question. Okay, go ahead, Supervisor Hashtag.
No, well, I was just going to say, what are the numbers for, say, 9%? Do you have those?
I don't have them in front of me. Michael, do you have them?
Yes, I do. So if you're looking at the the cost increase for a single employee, that, let's say we're going back to that Exhibit 3 on page 17, with a 12% increase, the single employee in Plan 2 will have his biweekly paycheck increase to $968. With a 9% increase, that same individual will have a $7.27 increase, a difference of approximately $2.40.
Yeah, I guess I was looking at the overall,
Oh, okay.
revenue
overall,
for the county.
Yeah, so the overall, I think if you go back to the good way to look at the revenue is with a 9% increase, going back to the, I guess, Exhibit 2, page 16. What we show there is with a 12% increase, we're looking at about 15.3 million in total revenue. With a 9% increase, the total revenue will be about 14.9 million. A 9% increase will be 14.9 million, about $400,000 difference.
Okay, thank you.
Okay, Supervisor McGordy.
Well, I'd like to go back to table 6, and this is where we talk about the large claim experience, and it looks like 2020 was a particularly big year for large claims. And I'm sure you're anticipating this as you're trying to project what the cost of the program is for us. And I just want to share with you experience I had with Ukiah Unified School District, which was also self-insured. And this is what kind of basically killed them being self-insured, because they had a massive claim that they thought they had, like a stopgap in insurance, but it failed on them. And in the end, they gave up on being self-insured and went to a PPO. And this is what makes these plans risky for our organization, is because you can't predict or contain these things. Somebody has a very, very serious illness, it's easy to run the bills up to a couple $1 million. And I'm guessing that that's what you're trying to anticipate as we look at increases of 12%. Is that part of the calculus?
So it is, and just we could take a step back. The County of Mendocino does have reinsurance, and that reinsurance level is at $250,000. So for anyone, doesn't matter who it is, employee, dependent, doesn't matter, if their claims exceed $250,000, every penny above that 250 comes back to the county, paid for by the reinsurer. Now you pay a premium for that, and that's included in the rate that's developed. I can tell you that in the last 3 or 4 years, you've had one or two more large losses than is normal. So historically and nationwide, what you would see in a group of 1,000 employee lives is roughly 2 to 3 large losses. You've had 4, 3 and 4 in each of the last several years. So, and to that point, we're receiving claims coming in now for a claimant that have just reached $1.4 million. But every penny above the reinsurance threshold is going to come back to the county.
Mm-hmm.
So that's the plus side of having the reinsurance. It's also important to note that you are in a PPO. Even though you're self-funded, you're in a self-insured PPO. And the reason we use the Anthem network is because in the state of California, the Anthem network has the greatest discounts of any provider network. And so, as an example, if your billed charges are $1 million, the actual amount paid is likely going to be somewhere around 500,000 because of the discounts that Anthem has with the various providers throughout the state. So, is it possible for a self-funded plan to go awry? Absolutely. The issues that you have right now are not solely the result of large losses, though you have had several.
How does this compare with insurance, group insurance rates, kind of sort of on average in the United States? Or I shouldn't say United States, I should say California, because California is more expensive than other places.
It depends where you are in California, quite frankly. If we were in Southern California right now, we would have rates that are probably 20 to 30% lower, in large part because of the larger population in Southern California, and there's much more competition. What you will find as you get farther and farther away from urban areas and you're more rural, the providers are a little more expensive. And the reason for that is, A, there's no competition, and B, if you're the only game in town, you charge what you charge. I will say, Anthem has done a very good job of, negotiating the cost of various coverages or various services, excuse me. But it's still the case that you are in a higher cost area. I'm in Oakland, where the cost is about 40% greater than it is in Southern California. It's less, it's actually even higher than where you are in Mendocino. It depends.
Thank you, Supervisor McGorty. Supervisor Williams?
Yeah, I think this discussion has moved us through denial, anger, bargaining, depression, and now we're up to acceptance. So pending public expression, I'd like to move that we accept the recommended action and direct that we keep the current formula in place.
Okay. Do you have any public comment on this item?
Yes, we do. The first and only person on the line is Patrick Hickey.
Hello, Chair Jurdy, members of the board, CEO Angelo. My name is Patrick Hickey, speaking on behalf of the Executive Board of the Mendocino County Chapter of SEIU 1021. I'm here today to address the proposed increase to the health plan for 2022. As the presentation demonstrated, the fund has done an exemplary job containing costs and keeping premium increases to a minimum. In fact, back in 2017 and 2018, the plan was so well funded that the county was able to take a 3-month premium holiday and waive employee contributions for 2 years running. For the past 2 years, employees have seen a 3% increase in their monthly premiums. But this year, the plan is proposing a budget-busting 12% bump for employees. This is taking us in the wrong direction and will erase some of the board's efforts to address recruitment and retention. Reviewing Keenan's presentation, we also question whether such a large increase is necessary. They project an increase in claims and expenses for 2022 of 4%, not 12%. Their charts on page 12 of the presentation show average costs going down by almost 5% from the most recent fiscal year. 2020 did see a big jump in large claims, but this is why the plan carries stop loss coverage. The county will recoup those costs. The county also has a health fund reserve that is not listed as part of the budget and revenue projections. The 2022 revenue projections on page 33 mention in the footnotes that it does not include the stop loss insurance or rebate for the CPPC prescription program. These funds should be considered as the county determines the funding that is needed. As mentioned earlier in the presentation, the county did not pay into the funds for 3 months in 2017 and 2018, contrary to the plan recommendations. We recommend that the county restore these funds, this $3 million, as a cushion for the health fund. This would help cover the INBR concerns. The data presented does suggest that an increase is warranted, but we would recommend that the board approve an increase of 9 or 10%. The board can revisit the funding levels mid-year to determine if any additional adjustments are necessary. Many county employees live paycheck to paycheck. Keeping a lid on costs in line with the steps that the board has taken to balance will help support staff and keep our staff working. Obviously, as mentioned, the issue of health coverage is a much bigger issue. If we can attract Kaiser to Mendocino County, that would increase our competition and would provide us with more options and opportunities. So I think that's the direction that the board needs to look at and the county needs to look at. So please take this into consideration. Thank you.
Supervisor Hashak. Sorry, Supervisor Hashak.
Thank you, Chair Judy. I would move an increase of 9% and to revisit this in 6 months to see how we're doing with the program.
Okay, I'm not seeing a second to that motion. Is there an alternate motion?
Well, I move the recommended action, and I agree with Patrick that we need to do something to support our employees. We see inflation is rising, cost of living is high in Mendocino County. I think we do need to address wages, especially at the bottom. But I don't support underfunding the health program. And I think our experts are telling us this is what it'll take to keep it viable. So the only question I have is, do we want to adjust the formula and have the county, the employer, pay for more of it? And if the board wants to have that discussion, I'm game. But I don't want to leave it underfunded.
Okay, is there a second to that motion?
Mr. Chair, I'll second. And the description of for instance, I believe it was employee only going at 9% was $7 and some change. And then with the proposal, it's $9.68. And I absolutely realize that our lowest paid employees, a few bucks can really make a difference for them. And I understand that. But the impact of not funding the healthcare plan would be so much more than those few dollars. And so I think it's important that we get the information about the additional costs to our employees and that they understand why this is a necessary step. Not as though the board has just decided we want to take additional dollars from them, that there really is a need for this moving forward. And I would like to keep on track. Obviously, I wasn't on the board when we were taking the holidays. I think it's much more shocking to have a 12% increase than a 3 or 9. And I would prefer that we look at a plan moving forward with keeping up with costs and not, unfortunately, not taking a break when then we're forced to add, such a large percentage to the employees' health insurance.
Okay, Supervisor McGordy.
So I feel a little bit odd about this because I've opted out of our healthcare plan because I have an alternative one that's offered to me, being given my age and the fact that I also have a UC Part B for Medicare. So I'm curious, is this plan negotiated strictly with local healthcare providers, or we also access healthcare providers in Santa Rosa?
You can absolutely access healthcare providers in Santa Rosa. Any provider that is in the Anthem network throughout the state of California, and then you have an out-of-network benefit that would allow you, it's what's called the Blue Card. It allows you to access any Anthem Blue Cross provider nationwide or non-provider. The reimbursement by the plan is a little bit different. So there's a greater cost to the employee or dependent if they go outside the network. But you absolutely have that choice. And because you're in a PPO, the employee and or dependent there is no requirement for referral from your physician. You can choose to go to whatever physician you like as long as they're in the network.
Okay, well, I basically agree with the philosophy that these things cost and you have to pay for them, and we can't let ourselves go into a hole that is going to end up, jeopardizing a balanced budget for the county. And I wish there were a better way to do this. I don't know if I'm assuming that this is a kind of a one shot, you have to do it for the year kind of contract, and that there's not a shorter time frame that we can issue a contract for. Is that correct?
So typically the renewal is done for the planned year, which is January through December. And all of so the Anthem contract is on an annual basis. Your reinsurance contract is on an annual basis. The pharmacy is on an annual basis. So yes, it's all based on the plan year.
So we get one shot at this, and this is our best guesstimate as to how inflation and our costs and how many people are going to get sick. I mean, you're working with actuaries who put this together.
So the short answer is yes. Michael is my head underwriter, and he works with our in-house actuary, who has also agrees with the calculation.
Supervisor Williams.
Would joining a pool smooth volatility?
It depends. I represent a pool with roughly 1,400 active employees. It's made up of 33 cities, special districts around the state. And their increase this year is about half of what yours is, but they only had one large loss, and their overall utilization has run about $150,000 per week. Your overall utilization has been running about $270,000 a week. So it's much the same as workers' comp is the best way I can explain it. You have a frequency and severity issues. The stop loss program handles the severity issue. Anything at 250,000, or if there's a laser above that dollar amount. The frequency issue is in part what's really been hampering the program. The reduction in the reserves by the premium holidays and the frequency of claims having gone up is also what's causing the fund to be as low as what it is. And so and Michael has the numbers better than I do, but the fund right now is just under your incurred but not reported requirement. So you're not fully funded. And in order to get to that level, we believe you need that 12% increase.
Thank you.
So I just have a couple final questions. So on the large claimants, which just a handful of cases each year, 3, 4 a year, driving up pretty big costs. And we do have the stop loss insurance. However, when you have really expensive cases that the stop loss insurance is covering, presumably the cost of that stop loss insurance over time will then go up based on actual experience. Is that the case?
That is correct. So just as an example, for this current plan year that you're in, I don't remember the exact premium, but it's about $1.2 million is the premium for the reinsurance. And they gave us a second year rate cap of 55%. Your reinsurance will not go up 55%. We will negotiate something significantly less than that. However, to date, the reinsurer has already paid over $2 million in large losses. So it was a benefit to have that coverage, even though it was expensive. You have already received more back than what you paid in premium.
Okay. And then the other issue is we have a plan 1 and a plan 2. And in past years, I think you've discussed them a little bit more than today. You didn't really discuss it. Do the employees truly pay 25% of the cost of plan 1, the more expensive coverage, or is that a 75-25 split? Or I guess my question is, it's a different plan. Are the users of that plan, because there are very few people in it, are the users of that plan contributing to the overall costs disproportionate to their numbers?
Right. So you have about 60 or 65 employees that are currently in that plan 1. The contribution split is the same, 75-25, but it's 25% of a bigger number because the deductible is lower, the benefit is better. It's a 90% in-network benefit versus the plan 2. And so the premium, the monthly premium is a little bit higher, and so they're paying the 25% of that higher premium.
But you're confident that the plan 1 is not costing the county more per employee than the plan 2 members, other than the fact that it's still a 25-75 split of the true cost of the plan?
Yes.
Okay. Okay, we've got a motion on the table. Were there any other final comments?
Yeah, I think just to follow up on that comment by Peter, I just want to make it clear, the large claims that occurred and most of the users of the plan have all come through plan 2. So when you see such a huge utilization going up for past 2-3 years, all from members in plan 2. The plan 1 members usage is very low compared to these large claimants in plan 2.
Okay, good to know. Any other questions or comments? Supervisor Hashak.
Yeah, I just think that we don't really know the full scope of this. And I think that, when we go to 12%, we're going to damage ourselves, and so I don't support this.
I have a question about that. Could you elaborate on what we don't know, or what would allow us to make a better decision today?
I think that there are some projections that we're basing this off of, and I think that if we went with a 6-month plan and then revisited it, it would be better for everyone, because I think that this drastic change is going to do us harm with our employees.
How do we, I would like to support you on that, but I have 2 experts in the call telling us that we're underfunded, and they think we need this increase to make the plan whole. If we go with a lower number, less than what they're telling us we need, what could go wrong?
Well, and then we come back in 6 months and say, oh, our experience is worse than we thought, and so we need to adjust it again.
Wouldn't that mean that we would need to adjust it more, which would be more painful than smoothing it by going with their estimate today?
Not necessarily. I think that if we smoothed it today, went to 9% or something, then we would be able to have that flexibility in the future.
Okay, Mr. McNamara, I see your hand raised.
Yeah, I just wanted to make sure everybody understands. You could have a zero increase, but the county, as the plan sponsor, is on the hook for every penny. So by increasing it at the 12% level, what we try to do is keep that 75-25% contribution rate, and then get us to a fully funded IBNR situation where the board has determined that we should be. Now, granted, it was several years ago, that was the board's direction. And so if you went to a 9%, and every single projection that my underwriters have made is accurate, then the county would end up paying 80 to 85 to 87%, and the employees something less. My point is, regardless of what you end up doing, the county, as the plan sponsor, is responsible for that claim cost. And so at 12%, we believe it's the most appropriate to keep that 75-25 cost share throughout the next plan year.
Okay, I see a hand raised by Sherry Johnson.
Thank you, Chair. Sherry Johnson, Deputy CEO. So the one thing that I did want to mention, that the numbers weren't up about the health fund trust balance, is that we are currently in a deficit in that trust fund balance of a little over $1.1 million. And then also with the health plan budget, so we had budgeted for about $18 million. But as you can see, the revenue is coming in at 12% is about a little over $15 million. So just to continue on what Peter was stating.
Okay. And just to recap, Mr. McNamara, you mentioned that the MERP plan, and maybe it has a new acronym, and that's the county's supplemental plan for those who are enrolled in a spouse's healthcare plan with a different employer. That's saving the county, you said, about, even though it's only 18 employees at the moment, it's about $250,000 in savings to the county. And yet it is a benefit for those employees who are enrolled in that. Are there any limitations that the county has on people enrolling in that program that maybe we might want to lift those limitations to give people an incentive to, and the availability to enroll in their spouse's healthcare plan and still get this benefit if it's truly saving the county money?
So right now there are only two that I'm aware of that the county has. One is the county requires that an individual be enrolled on the county's plan at open enrollment so that they can choose that benefit or not, like they would choose Plan 1 or Plan 2. And you have about, don't quote me on the number, but it's roughly 100 employees to 120 employees that waive coverage. And the reason for having the requirement of being on the county's plan is because they waive coverage, it costs the county nothing. And so, because they've gone to a spouse's plan, likely because that plan is financially more advantageous for them. Now, if you say we're going to drop that requirement and let those folks, because they're an employee, we're going to allow them to opt into the MERP program, then you would have an increased cost of, at minimum, the copays, co-insurance, and deductibles up to the federal limits. So for an individual this year, it's roughly $7,000, and for a family, it's roughly $17,000. So you'd have an increased cost as opposed to decreased cost.
Okay. Are there things that the county could do to just better educate the employees about the MERP plan who are currently on the county's healthcare plan? Because there may be county employees who are eligible to take advantage of that program.
Yes, so what we've done is working with Emma and Sherry's team is we've created some collateral material to let them know of the name change and how they can participate in its change to complete care, which sounds a whole lot better than MERP. Then it'll be on as part of the open enrollment, the online open enrollment program. So that's one way. We could certainly put together collateral material that gets emailed to employees. One of the things that I've found when you have all employee emails go out, they seldom get read. And so, that's one issue, but communication is really the fundamental way that you would be able to increase participation.
Great, thanks. Do we have any other questions or comments, or can we go to roll call? Okay, not seeing more. So we have a motion on the table. Can we have roll call?
Yeah, I just want to clarify, the motion is the recommended action as written, correct?
Yes.
All right, Supervisor Mulhern,
Yes.
Supervisor Hashak, Supervisor Hashak,
Oh, no.
Chair Jurdy,
Yes.
Supervisor Williams, Supervisor Williams, you were muted,
Yes.
and Supervisor McGordy.
Yes.
The motion carries with Supervisor Hashak dissenting.
Okay, so we're going to go to our closed session items in, let's say about 10, almost 10:25. We'll go into closed session at 10:45. Does that work for people?
But it's 12.
At 12:25, yeah. At 12:45.
Excuse me.
Mr. Chair, I might suggest that it be a slightly shorter, we do have outside counsel that's been waiting since noon.
Okay, 12:30. Okay.
Yes, 12:30 works.
we're going to report out of closed session, looking to county council for a report out of closed session.
Thank you, Mr. Chair. The board met in closed session to consider items 9B through 9G and took no reportable action.
Okay, thank you. I think next that brings us to item 5C, which is the new jail facility update.
Chair Jurdy, this is CO Angelo. I'm not certain if I thought our strategic plan was actually supposed to go at 1:30 because of our consultants.
Oh,
So
good point, yeah.
Yeah, I would just ask the clerk about if the consultants are ready, if you would prefer to do the strategic plan or what your pleasure is at this point. Atlas, do you know?
Yeah, yes, it is my understanding that the consultants and Ann Mulgard are ready to present.
Okay, thank you.
Okay, so we're bringing in BJ, and then we're waiting on Miss Mulgard as well.
Hello, are we supposed to just start, or what would you like for us to do?
I think we're waiting for Ann to join us as well.
Ah, got it. Let me go ahead and share my screen a while to save some time.
Okay, so we've reached back out to Miss Mulgard. CEO Angelo, I don't know if you want them to proceed with the consultant or if you'd like to wait for Ann.
I think that's up to our ad hoc supervisors, McGordy and Haschak, if they would like to proceed or wait. Thank you.
I think we can probably proceed, and then we'll have Ann backfill with comments.
Yeah, let's go ahead.
Sounds great. Let's go ahead and get started. It is my pleasure to present to you with Gary Hockman this afternoon about what we've accomplished so far on the strategic plan. And we're going to share some emerging strategies that have come out, as well as letting you know what our next steps are. So just to let you know, to remind you, this process started in July and will conclude by the end of January. And this is just our first update to the board. We're delighted for this opportunity. So let me go ahead and move forward. Just want to share with you a little bit, just to remind you of what strategic planning is. And basically, it's an organizational management activity that's really going to help you set priorities. And it's really going to also be an opportunity to focus energy and resources of the county organization to be able to strengthen your operations and make sure that everyone on the team, all the employees, are really working toward common goals. And it will give you an opportunity to establish agreement on outcomes and results. And really, it's a good time now to engage in a process of planning, because it gives you a chance to assess where you are and adjust your direction in response to a changing environment. And obviously, we've had more changes now than ever, being in a global pandemic, and certainly with all the wildfires we have been experiencing on an increasing basis. So it's a great time. And the characteristics of a plan, as you know, it involves stakeholder input, and we're getting ready to engage in a lot of that. We've already done quite a bit of that already, both internal and external stakeholder involvement. And it really creates a vision that will then allow you to set priorities to make that vision come alive. And we're going to be defining specific goals and actions to help you achieve those priorities that you identify. And it's really, in the long run, going to help the staff align their work with your priorities. So everything cascades down from the priorities that you establish to the work that the line staff complete on a day-to-day basis. And it'll give you a chance to monitor performance and progress. And the best thing is it will allow for flexibility, the way that we're creating it. So Gary's going to share a little bit with you regarding what the process looks like and our timeline. Gary? I wonder where Gary is. Let's see. I don't know. I will continue, but I will tell him we're on. I thought he was on. So I just texted him. Excuse me. I thought he was on. So as you know, in July, we were involved in the planning and the launch of the project. And in August and September, we've been building an initial strategic framework. And I think Gary's on now. So Gary, you want to take over from on this slide?
Thanks, BJ. Yeah, I didn't have access. Welcome, supervisors. So I'll just keep rolling where BJ left off. So this is a slide that actually describes two important parts of the project. One is the timeline on the left, and on the right is the nomenclature that we're using. So if you follow the timeline, we're largely on track here with this timeline we created in July. We've done our launch work. We've met with all of you and CEO Angelo. So now we are building this initial framework, and we went last week to the department heads and did a Zoom meeting where we gathered their input that will inform the framework that's emerging at this point. Next, we're going to engage employees, and at this point, we plan to do both a survey as well as some focus groups, and then out to the community to get their input as well. So the employees in the community aren't going to be filling up a blank sheet of paper. They're going to be responding to the initial inputs and ideas that you provided and that the task force helped us shape. In November and December, we're expecting that we can start finalizing the plan and then bring it back to you for approval, probably in the January timeframe. So that's the flow, and again, largely on track with that, so we're feeling good about that. BJ will get into some specifics about the work that's been accomplished and what's coming next. On the right side of the page, and we do this with the task force, we've done it with some of you, but it really helps just to get the nomenclature right, because depending on the different organizations you work with, some people use different terminology for these different elements of the plan. So the broadest piece for us is what we're calling strategic pillars or strategic priorities. And these are the focus areas of the plan. So far, and I'll share with you in a few minutes, we're coming up with 4 that we think help shape the plan and define the plan. Under the level of pillars or priorities, we have goals, and these goals are broad outcomes, and they're really sort of visionary in nature in terms of that they express some broad desires. But then the level below that, the objectives are much more concrete in terms of what we're trying to accomplish by when. So these might be concrete stepping stones. They could be identified as percentages with dates even, dollars associated, et cetera. But they're just much more concrete, and everybody can look at it and know exactly what we're talking about wanting to achieve. And then finally, the action plans. And most of the action planning is going to be done by your organization, but we will leave you with a process for doing that as well as for tracking progress against your plan. So I just wanted to run through this briefly so you all are on the same page when we use terms like goals and objectives and so on. And then just to go back to the left-hand side of the page, the framework that we're building ultimately will include the pillars, goals, and objectives. At this point, we have a very rough draft of 4 pillars and goals that we'll share with you in a few minutes. Thanks, BJ.
Sure. We just want to also share with you who is involved from the county in helping us shape this. And Ann Molgard is the project manager, and we're real pleased to be able to have the opportunity to work with her. And she has put together a task force, and that is the members are listed there for you. We've got Buffy Barasa from Behavioral Health and Recovery Services, and Katie Ford from Human Services. Many of you may know these individuals. Elizabeth Garcia from Agriculture, Eisen Locatelli from Probation, Michael Oliphant from Planning and Building, and Megan Van Sant from Social Services. And then you'll see we've got 2 ex officio members there. We've got Supervisor McGordy and Supervisor Hashak there. And the way that came to be is that when we were having our individual interviews with both of those supervisors. They said, we'd love to be on the task force. Is that possible? And we said, absolutely. So they are on an ex officio capacity. Usually in the beginning, they'll say, hello, welcome, and then usually one will stay or the other so that it's not overwhelming for the task force to have two supervisors there. So it works out really well. And the team's been really working hard to be really honest about that. And they're very dedicated. No one misses meetings. They're really, really quite helpful and knowledgeable. Let me tell you what we've been able to accomplish so far. We've obviously communicated this planning process with the employees, and there is a section on the website established telling individuals what the various phases are and who's involved. And an email, I believe, has been established so that if anyone has any questions, they can be directed to that email address. We've had individual interviews with all 5 supervisors, as you know. We also had 2 individual interviews with the CEO. We meet with the task force twice a month in our jam-packed agendas. Our meetings are an hour and a half each time. We had, as Gary mentioned, we have had a department head meeting just last week, and it was also very informative, and the department heads really gave us some really forthright feedback. We've developed some pillars, strategic priorities, 4 of them that are emerging that we want you to see in just a second or two. And now we're in the process of developing a strategy to get internal and external stakeholder input. So Gary's going to talk a little bit about these emerging strategic priorities or pillars that are coming out based on what we're discovering from our conversations with you and the rest of the employees.
So I'm going to share with you these pillars and then some tentative goal ideas. We will send you a document as well as individuals and solicit your feedback. So this is an iterative process. And again, as BJ said, this is emerging. This isn't a fait accompli. This is really what we've been hearing and trying to put some shape to. The central pillar there, the central priority is about effective governance, an effective county government organization. And what we heard loud and clear, not only from some of you, but also from our task force and some of the department heads too, is that this is really central. And without getting this work done, the other elements of the strategic plan just won't get accomplished. And so we're kind of placing this at the center visually to emphasize that. The 2 other areas, or 3 other areas on here, one has to do with a safe and healthy county. And that's really about the health and well-being of people. And I'll describe that with a little more detail in a minute. Another has to do with resiliency, and much of that is about preparation and natural disasters, frankly, but also transportation and some essentials that we've heard described. And then the last one has to do with livable economy and economic development. So BJ, if you can advance it, I'll spend a little more time on each of these. So what you see as bullets under these 4 pillars, these 4 headings, aren't written as goal statements yet, but they're broadly describing, again, what we hear and what we believe may evolve into goals over the course of our conversations with your employees, with the community, and more conversations with you. Incidentally or not incidentally, they support your mission statement about having a responsible and responsive government that enhances the quality of life for people in Mendocino County. And in fact, when I saw your mission statement, I was looking at it earlier today. A lot of the key words from this page are also resonant in your mission statement. So the first one has to do with effective county government organizations. This is governance in terms of your role vis-a-vis the CEO's role, et cetera, collaboration between departments and so on. Attract and retain the best people. Diversity, equity, and inclusion, and that's internal to the organization, but it's also how you work in the community as well, and ensuring that your policies, processes, outreach are done in a way that promotes social justice and equity in your communities. Operational efficiency, and most organizations are finding they need to do more with less resources. And how do we do that? including engaging technology, process improvements, and so on. And the last one has to do with increasing transparency. Part of that is in the spirit of building trust between the government and the community as well. Second pillar has to do with a safe and healthy county, and this is the one I mentioned, really is about well-being of people. You can see the items there: basic needs for under-resourced families, prevention-focused public health, behavioral health services, and a sustainable environment. And a lot of that has to do with water supply and some other elements in the environment. Third has to do with economy. So what can and should the county do relative to supporting a vibrant economy? And we've heard, everything from ag to high tech to cannabis, obviously, and tourism and wine and so on. But there's a lot of different segments. Affordable housing opportunities, and then finally broadband communications, recognizing that there's a lot of opportunities for remote work for people living in Mendocino County. And then finally, this area that touches on public safety too, a prepared and resilient county, disaster preparedness, rural fire protection and emergency medical services, and then transportation and road system. So again, these all could be goal areas. They aren't yet defined as goal statements, but this is what we're hearing and generally getting supported from department heads. We are going to take their input and fine tune this and to create a framework then that we will send to you for your reactions and your input. So you'll have plenty of opportunities to touch this along the way. One of the challenges I just want to alert you to, and it's probably not a surprise, and you might be thinking about this already, is that ultimately strategic planning is about choice. And I think it'll be important as we go through this to do some discernment, because we can't boil the ocean. You can't do everything you want to do, partly for human resource reasons, but also budget limitations and other reasons as well. So at some point, we're going to need to really take a close look at this and determine what's doable, because we want to leave you with a plan that's manageable and achievable. Otherwise, we can help you just grow a lot of cynicism and discourage folks too. So we really want to be able to leave you with a plan that's achievable, and that's going to require some difficult choices likely as we go down the road. Back to you, BJ.
Thanks, Gary. We just also want to share with you what our next steps are. So in October into November, we're going to be doing surveys, focus groups, talking with individuals, both internal and external to the county, just to try to get some additional input on what people think are important priorities and really what needs to be accomplished by the county in the next 5 years. And then we're going to get some additional targeted department head and CEO input. And to do that, we'll be scheduling individual meetings, or it could be small Zoom focus groups, just based on very specific targeted questions that we have. And then we're going to continue to get supervisor input, which is absolutely important that we have that iterative process as we move forward. And then we're going to be working with the task force to integrate input we get from the stakeholders into the strategic plan. What we do is as it is now, we've been gathering information and going back to the task force, getting their thoughts, going back out to another group, and et cetera. So it'll be back and forth like that. So for example, the information under those strategic priorities that Gary just shared with you, we shared those with the department heads and got their feedback. So what we'll do with the department heads, with the task force that we meet with on Friday, we're going to be taking that feedback to them. And again, we're not saying what department heads said what specifically, but saying, okay, now how do we change these pillars to reflect what the department heads are saying is important? But by and large, the department heads, as Gary was saying, they really do agree with those areas at this point, certainly with a lot more detail though. And then we'll go ahead and revise the framework to reflect employee and community input. And then we're going to be developing some draft goals and objectives based on the stakeholder input that we'll be receiving. So in a nutshell, that's our update. And we're wondering if you have any questions or comments. Gary, anything else to add?
No, I'm good for now. Thanks, BJ. Curious if there's any reaction.
Okay, thanks. Supervisor Williams.
Can you jump back to the pyramid?
Sure.
So first, I think you're on a good track. I appreciate the work you've done, and I have high confidence here, which is a lot coming from me. A livable economy, I think, may be a foundation for all of the other items on the list. If we don't have an economy to tax, we can't provide any of the other services. Are you thinking about drilling down more on what our legacy is in enabling a healthy economy and how we may be able to steer it going forward?
Say a little more about what you mean by that, Supervisor Williams, when you say legacy and drilling down.
Well, I mean, I see two columns here. I see a revenue and a liabilities, and the livable economy is a revenue source because it's something that we're going to tax, and everything else, providing a safe county, providing social services, having an effective government organization, a resilient county. I think that's probably public safety, fire services, EMS. Those are all expenses, right? And the reality is Mendocino County can't provide a base level of service that meets public expectations today. There's not enough money in the pot. So I'm curious whether you're going to get into more detail in the interview process on how we want to build an economy that will provide the revenue adequate to meet the other demands.
So I think we're starting to hear about that. I mean, obviously, one of the goals that you saw had to do with, supporting the vibrant economy. What came up in the department head meeting were some revenue ideas, and hopefully we can continue to mine those to discover what other sources of revenue might be available. And some of it might require investment, frankly, but I'm hopeful we'll hear more of those ideas. It won't be necessarily coming from us, but from you and the others.
Exactly, you're facilitating it. So ideas about the decisions that we can make going forward that will enable the businesses to thrive in our county. I would say today we're not. It's hard to do business in Mendocino County. Try getting a business license. Try going through the plan checks, right? There's a lot of buildings that don't qualify. There's a lack of broadband. And the sense I get is we want housing, but we don't want development. We want broadband, but we don't want wires or towers. And we don't have a good track record of tying our decision-making, what we're against, to the consequence. And I think if we could be more upfront about that and look at 10 years out, where do we want to be? And we may have to make some compromises. What are those compromises that we have to make? What is the process for making compromises? How does the board discuss the trade-off, something that we're not crazy about, but the revenue that it'll provide, that'll translate to services and water infrastructure and all the other parts of government that we need? Is that something that you may be able to touch on?
I don't know about the compromise process. I think to me that fits in with, the governance process and the first pillar. But I think we can certainly talk about some of the plan itself will include some of the sources of revenue that people agree you want to go after, and some of the investment that's worthwhile to make. The process itself of making the sausage won't be in the plan. Hope that makes sense.
Thank you.
Are there other questions or comments? And I'm wondering if the supervisors who are on the task force want to make any comments. Supervisor McGordy?
So putting an effective county government organization at the heart of our plan, I think, is really critical, and because we have less control over things like a livable economy, though I agree with Supervisor Williams. We send a lot of mixed messages. We say that we want one thing, and then when we try to do it, we get a lot of pushback from the community. And that's something that's frustrating, is that there's 91,000 of us, and we all have really different opinions about things. So sometimes it makes it a little bit difficult for us to make decisions and come up with good answers. But what I'm hoping for out of this is that we do get some process, but we do know how to work and tackle issues, and we identify what things are worth going after and what things we have a realistic chance of being able to actually make an effect on, and that that will be our legacy, I believe. And I think the fact that we're even going through this process is already a step in the right direction. And after Supervisor Hashtag speaks, I'd also like to hear from Ann Mulgard.
Sounds great. Supervisor Hashtag?
Yeah, thank you, BJ and Gary. I really appreciate your update on this. You know, I agree with what Supervisor McGorty said, is that, you know, what we have most control over is effective county government and how we're organized. And that's our purview more than anything else. The others are, you know, corollaries to it. And looking at the safe and healthy county, or maybe it was a prepared and resilient county, where you talked about emergency medical services and fire, and I didn't see law enforcement. And I think that law enforcement has to be, you know, highlighted here, because we're seeing that the sheriff's department or office isn't fully staffed, and the issues, you know, issues that we're seeing in our county are beyond their control a lot of times. And so I would like to see law enforcement highlighted.
Thank you. And we've heard that feedback as we've been sharing this with the department heads as well. Gary, anything you want to add on that?
No, the only other thing I might add is that when we think about what belongs on the plan, I want to encourage us to be thinking, what specific goals or achievements do we want? So while I completely get the law enforcement piece, and we actually heard from the sheriff at our meeting last week, we need to, at some point, we're going to need to think very concretely of what's achievable. What is it that we really want to accomplish over the next 5 years? Because almost all the departments in the county and all these different dimensions would love some support, advancement, and, you know, improvement, et cetera. And again, it's back to choosing what do we believe is you know, is a worthy goal and worthy of our efforts and resources. So, so again, I think law enforcement is a theme we've been hearing several times, and we need to keep focusing our ideas in terms of what's achievable, what do we want to accomplish, and what resources are we willing to put behind it. Thank you.
Point. Ann, do you want to make some comments? I think you're on the phone, Ann.
I thought she had to go to a doctor's appointment, BJ.
I know, but she's on the phone. But I guess she just.
Oh, she is. Okay.
But I guess apparently not. Other questions? This feedback is
Hi.
Really yes, you are. I knew you were there.
Okay. Sorry, having a hard time. I think we're in such a tough time right now. It's so busy. We've still got COVID rampaging. We've got fires. We've got drought and water issues, that I appreciate the time that the board has set aside to talk about this during the process and at the end of the process, because I think that everybody's a little distracted. It's not a normal strategic planning year. Maybe there's never a normal year anymore, but I do appreciate the fact that that you're moving ahead anyway, and not just saying, okay, we're too busy, because then we'd never get to it. The department heads who were not able to meet with the facilitators, I'm offering them a separate time to see if we can make sure to get their input. And then I look forward to the next stage of employee input as well.
Great. And that meeting was well represented, as I recall, the department heads. Supervisor Williams.
So a lot of the feedback I hear is about what more the county could do, what more local government could do. And one of the worries I have is looking at the budget and the increasing costs of providing services relative to the increase in revenue, which doesn't seem to be keeping up. It'll be difficult 5 years out to provide the level of services we see today, unless there's some sort of structural change, reorganization, outsourcing some of it, reducing scope. Something will have to change, because we're not likely to see more revenue, and yet we will see a higher cost in providing the existing services. Is this something that will be tackled by the strategic planning? If we have to give up in an area, what's at the bottom of the list? What does the county as a whole think it can give up to prioritize some of the other needs?
Yeah, and I think it's a question, I think, where you'll need to, we will help you prioritize what's in the plan. So if you have to make those trade-offs, you can take off the bottom layer, but ultimately it's going to be your job with your CEO to crosswalk this strategic plan with your budget to make those determinations. What can we do in year one? What might need to wait till year three? What can we do a little bit every year over the next 5 years? And what do we need to take off the list?
I appreciate that. Other than from me, have you heard any concern about the county finances?
Mostly from the department heads who said maybe there's some ways to generate revenue. That's where we had the most explicit discussion anyway, in one of the groups there. And I think everybody we've talked to is conscious of the trade-offs and that what we're talking about on almost all of these is investment.
Supervisor Mulheron?
Thank you. I appreciate the outline that has started about the strategic priorities and the slide that looks like the pillars, I believe you said. I think it's incredibly important that we have the diversity, equity, and inclusion at the top of our list and at the front of our minds as we're having these conversations. I'm concerned about the ability for department heads, employees, and the public to provide feedback anonymously. And I think that you said that you're going to do a survey. And so I'm wondering what opportunities department heads, for instance, have to speak with each of you. I understand you went to a meeting, which of course is full of many people that may not be able to feel comfortable speaking candidly. So what are the opportunities for anonymous thoughts to be given to you all for inclusion?
So I don't know if it helps, but we did small group work there. So they were talking in front of 3 to 5 peers instead of 16 or 18. We've also offered them all the opportunity to contact us individually and to provide feedback either via phone or email to us. And then finally, they will all participate in the survey as well. So they'll have that opportunity to provide feedback. That would be the most anonymous, obviously. Do you think that would suffice?
The jury is out on whether or not people respond to surveys, but I'm always hopeful. So thank you for that.
Okay. Yeah, and BJ and I have had some conversation about this, and you can help calibrate us, but we believe that a lot of the input they would provide for a strategic plan might not be as sensitive as some that they would provide for, let's say, a department plan or something that was related to performance, as an example. So we're hopeful that the kind of conversations we're generating with them don't have the same kind of heat, and that they're really thinking big picture in terms of what could be accomplished over the next 5 years.
Supervisor McGordy?
Just want to thank the task force and department heads for working on this. And of course, Ann, I know Ann's very, very busy right now trying to run a department that needs some reorganization and restaffing. So the process is going well, and of course the consultant. So from my perspective as an ad hoc member, I think that this is going well.
Thank you for that. And I think I saw Supervisor Jordy. Yes. Chair Jordy.
Yeah, so I like the strategic priorities that you've heard from people already. Under safe and healthy county, one thing that comes to my mind that's not really shown in the current 4 bullet points would be peace in the neighborhoods. And I think we've heard quite a bit about that as it relates to cannabis, but I think it goes beyond that. The board in the last maybe 5 years has pretty substantially increased its code enforcement division twice. And it's been a response to public requests for shutting down illegal commercial activities in residential neighborhoods. And we've just done it again. And so I think, that issue of peace in the neighborhoods, it might traditionally be thought of as something that's in the bailiwick of law enforcement. But, I think it's really something that's multi-departmental. It's planning a building, it's code enforcement, it's law enforcement, it's the district attorney, it's all sorts of departments that get involved with that, maybe environmental health. So I don't know, I just think that that would be maybe a bullet point that would resonate with a lot of people.
Thank you for that. That's great. Supervisor Hashak?
I'd just like to say what Supervisor McGordy said is that thank you for all your work on this. And really thanks to the task force and department heads and all the employees. We really need your involvement in this to make it really valuable and important for what we're doing. So if everyone could participate, that would be better. This is your chance to, be part of this strategic plan and what our vision is for the county. So I wanted to encourage people to do that.
Thanks.
Thanks. Anything else that you wish to share, or any questions that you might have for us?
Thank you for your support too. It's meant a lot to us to get this launched, starting with you, and then we will circle back again, one with more detail on the framework, and then we will also be able to get your input at different points throughout the process. So when we get to the finish line, you should have your fingerprints all over this, which is the way it should be.
Absolutely. Supervisor McGordy and then Supervisor Williams had comments.
So my goal is to make this a great place to work, that you want to come to work here and you like working here. And I think a strategic plan is going to help us clear the path to make that a reality, among other things.
Thank you. Supervisor Williams?
I was urged to hold off on the CEO versus CAO discussion until we complete the strategic planning, but saying that this may not come to us until sometime in January doesn't leave very much time to have that discussion and think about next steps. What do my colleagues have in mind in terms of timing and process? Do you really want to wait until this is complete?
I think he's asking his fellow supervisors.
I am.
Yeah, so I think we can have that discussion most any time. It may actually be with a different group of people, and it may not be with our consultants. Our consultants may capture our reaction, which could be brought into the strategic plan, but I almost feel like that's a separate piece. And then the other thing that if we decide to go CAO methodology, it puts the onus on us to be more accountable to the departments. They've got to be able to reach us, and then we have to start thinking about, okay, so how's that going to work? Are we going to group departments with common themes? Well, like social service, natural resources, public infrastructure. So these are all things that is a big discussion that we will have to decide when we want to start that. The strategic plan should give us the methodology for how to go about those discussions in a meaningful way. I think that's why this is important.
Looks like the CEO has a comment. And Supervisor Hashak.
Chair Jurdy, yes, I just wanted to say in response to Supervisor Williams' question, we actually have a discussion forecasted in October. I believe, I'm going to say it's October 26th, that meeting we actually have an agenda item to look at CEO versus CAO, and then of course the other concept that the board has been looking at, which is a chief financial officer. The goal is to pull this all together and bring those concepts to the board to get direction. This would be, this does not take away from the strategic planning process. And actually, I have talked with BJ and Gary about this, and this came out of actually a board discussion not long ago. And it's very clear that the board has a desire to really look at the CEO versus CAO model and possibly do that before January when the strategic plan is done. So we do have this scheduled for October 26th. And since you're asking, and I have the full board in front of me, the goal was to look at CEO versus CAO, to look at chief financial officer, which is another concept that this board has discussed, and possibly look at OES, and that would be one agenda item. If this is not what the board desires, this would be the time to tell me, so we stop planning. But the goal was not to wait until January, and this would be in concert with the strategic planning process, not competing with the strategic planning process. But I have heard that there is some concern about getting to this particular topic sooner rather than January. So I take any direction from this board at this time. Thank you.
That sounds like a good plan.
Yeah, and I would totally agree with that plan too. You know, we need to start tackling it sooner than later.
Yeah, I think so as well.
This is Ann Molgard. I think CEO Angelo was clear, but our thought was that the consultants before you today for the strategic plan would be observers of that meeting, but they would not be leading it.
Yeah,
Yes, that makes sense.
Thank you, Ann. Yeah, thank you.
Yes, that's our understanding.
Okay. Do we have any public comment on this agenda item?
No, we do not.
Move the recommended action.
A second.
Okay, can we have roll call?
Supervisor Mulhern,
Yes.
Supervisor Williams,
Yes.
Chair Jurdy,
Yes.
Supervisor McGordy,
Yes.
and Supervisor Hashak.
Yes.
The motion carries unanimously.
Okay, well, thank you.
Thank you.
Thank you. Bye-bye.
Okay, I think this might be an appropriate time to go to the jail project.
We're bringing in the presenters for that item right now.
So good afternoon, Mr. Chair, members of the board. Steve Dunnicliff, Deputy CEO, here today with Sheriff Kendall and Captain Pierce. In 2017, as background for this item, the Board of Supervisors authorized the submittal of an application to the Board of State and Community Corrections, BSCC, for a new jail building to provide specialty housing and expanded program space. The state awarded the county with $25 million in funding, and the county committed to a local cash match of just over $1 million. It was $1,046,740. RFPs, or requests for proposals, were released to procure architectural services and construction management. In 2017, Naughton Lewis was selected as the county's architect, and in 2019, Banner was selected to provide construction management. As this project has been developed, there have been consistent efforts to contain costs through design, even as costs overall have increased. The county's initial match of just over $1 million has been increased through subsequent board actions and currently stands at $2,796,740. In recent years, there have been a number of historic impacts to construction costs, starting with rebuilding thousands of housing units lost to regional wildfires, then tariffs on construction material, and supply chain impacts due to the ongoing global pandemic. Additionally, the state's project approval was extended due to a change in their process. At this point, I'd like to introduce the county's architect, Eric Vadnais, and invite him to share a presentation with the board, which provides a project overview, an updated timeline for construction, and the latest construction cost estimate, which reflects a funding shortfall of $3.6 million.
Thank you, Steve. Good afternoon, Mr. Chair, members of the board. I'm Eric Vadnais, principal with Naughton Lewis. My presentation this afternoon will give you an overview of the project to date, in concluding with the current schedule and estimated costs for the project. So first, a reminder of the mission of the new jail facility. The mission is really to provide a facility that will be a special needs housing unit oriented toward individuals needing medical and mental health treatment. And as such, the facility will provide an environment for positive behavioral change with the goal of enduring beneficial outcomes for the individuals. Now, the guiding principles for the project were established in alignment with the mission statement as a guide for the design of the facility. So many of the principles are in response to the challenges of operating and maintaining the current facility. The intent is to achieve a therapeutic and supportive environment that is ligature-free, safe, and secure for staff and inmates. Also, to design for future flexibility and integration of technology, and to design for a 50-year lifespan and reduce maintenance costs. And then another important matter of the previous sheriff was to avoid flat roofs, an ongoing roof maintenance concern that the county has with the current jail. So with the original application for funding to the state, Site A was the original site. The site's located between buildings 1 and 2. It was within the secure perimeter and constrained by the surrounding structures. It required demolition of housing wing on building 1 to create room for the buildings, and it would require a multi-story building to accommodate the full needs of the housing and treatment spaces, and also a separate building for family and visitor, family and attorney visiting. So the multi-story building, was a safety and security concern for the sheriff's office because it would require moving inmates by elevator, which is not an ideal situation for moving high-risk inmates who are seriously mentally ill. So as the project proceeded following the funding application, we looked at another site, basically. So following the funding application, we looked at Site B, which is located outside of the secure perimeter east of Building 1. That would be within the Fleet and Facilities Division parking lot. Although it requires relocation of the parking lot, the location provided more land area for the facility, which would allow for a single-story structure. This proved to be more cost-effective as an approach compared to Site A. A single-story structure is less costly than a multi-story structure, and the entire project can be constructed outside of the secure perimeter, saving the additional cost of security that would be required for construction within the secure perimeter. And usually that amounts to about a 15% markup on construction costs. So looking at the evolution of the project from that pre-design phase, you're now looking at the ground floor plan. And I will say that the footprint has slightly changed since this version that you're seeing here. We have done some further reduction of the building square footage. But what you're looking at here is really the plan which is laid out for operational efficiency and cost effectiveness. So line of sight into each of the 6 housing units, the recreation yards and program rooms are all possible from a central location. You can see that at the very center of the plan is the station for clinical and custody staff. Inmate movement can be minimized as the program rooms and recreation yards are directly accessible from each housing pod. So the treatment areas provide, there are treatment areas which provide appropriate rooms for medical and dental exams as well as respiratory isolation. They're all within close proximity to the housing pods. So needing very little movement of inmates through the facility to get to treatment. Also, a new visiting area to the north provides space for in-person family visiting and professional visits for attorneys. Now, the next series of slides, we'll look at the building perspectives, the building elevations and sections. These illustrate that the volume of the building was much taller to achieve greater roof slopes. This proved to be costly, and initial estimates due to quantity of masonry and steel needed to achieve the sloping roofs. So in following iterations, we were able to reduce the height of the building and we were still avoiding flat roofs, but we were able to achieve still an adequate volume of space and still save cost. So we were able to reduce the cost of the building by reducing the amount of structural material required. You can see the axonometrics here that kind of give you an idea of the changes in the building form. And so this building perspective illustrates the public face of the building and the final design at the conclusion of the design development phase. And as I said earlier, we have undergone some further reduction of the building area for cost reduction. And so it does change this perspective slightly, but in general, the architectural character remains the same. So now we'll move into the project budget. Let me hold it here. Okay. So before we get into the details of the project budget, I just want to go through some of the terminology that we include in the estimate. So when we talk about hard costs, these are the construction costs, so the materials and labor and the general contractor markups. All other costs are soft costs, which include architectural and engineering fees, construction management fees, movable furnishings and equipment, construction materials, testing and inspection costs, and other costs. There's also contingencies. And so the contingencies are built in for design and estimating. The design and estimating contingency addresses the cost of undocumented design elements during the development of the design of the project. And that particular contingency diminishes as the design is completed. There is also a construction contingency built in, which is the county contingency for unforeseen conditions and other change orders that may arise during construction. We also build in cost escalation to the midpoint of construction, as well as a geographic market factor, which addresses potential high labor and material costs due to Ukiah's more remote location. So now we'll look at the project funding. In your initial application, you had applied for a full reimbursement of $25 million with a county match of a little over $1 million and a total project funding of a little over $26 million. Going back to the pre-design phase, when we studied the initial site, site A versus site B, by comparison, site B won out in terms of cost. For the reasons I mentioned earlier, the cost to build outside of the secure perimeter and the fact that you could build a single-story structure. So that was the first look at cost. And realizing that even though site B was more cost-effective, there was still a budget concern. So we began looking at cost reduction measures. We looked at building square footage reduction. we looked at soft costs. We also found that within the soft costs, there was a substantial surplus in the what was budgeted initially for the furnishings and equipment. So we were able to, find some savings there. So that did get us closer to budget. However, even with Site B, the project at that time was still $1 million over budget. So as we proceeded with the design, we looked at further, cost management strategies, and we focused on site work, where we were able to look at paving and earthwork, as well as landscaping and irrigation costs and site lighting, and we were able to find some reductions in all of those areas. We also looked at building costs. And as I mentioned earlier, we were able to find a substantial amount of savings just by reducing the volume of building that would be constructed. So that helped to reduce the structural costs and the building envelope costs quite significantly. And we worked through additional cost reduction efforts with the Sheriff's Office and found reductions in other building systems and materials and equipment. And we continue to do so. And as you'll recall, in our energy study for the building, which was presented to the board last year, we reported that there was little to no cost benefit to providing the 2-inch layer of rigid insulation on the new housing unit. So by removing that, we were able to save a substantial amount of money. The study showed that due to the building's thermal mass and energy performance, the energy savings provided by the insulation was very little. So also, as I mentioned earlier, recent changes to the building footprint and some of the structural elements, the steel brace frame, changing it to a masonry shear wall across one of the major walls of the building should prove to provide some savings, but that has yet to be determined. We'll find that out when we get to our next estimate. And as you know, there have been some cost additions. The change from gas heating units to mechanical heat pump system, that did add some cost. And more recently, a change to permeable paving, which is an important element of the stormwater retention system. So now we'll look at the milestone schedule for the project. We're currently approaching our 90% construction document set, which we'll be submitting for review in November, right around Thanksgiving. And then we hope to be ready to submit for agency review by early December. From that point, to get to the approval stage with the state for approvals to proceed to bid, we're looking at about 6 months. And so if all goes well, we meet that milestone, the county will be out to bid in June of next year. And then jumping ahead, once bids have been received, we're looking at approximately September for contract approval and notice to proceed to construction. So late September, roughly, with construction completion in late March of 2024 and occupancy of the building in late June of 2024. So current costs, as of today, or as of this month, costs are projected for construction costs, 24.7 million, an increase of over 14.5% from the June 2019 design development phase estimate. That's a substantial increase. This increase is based on the California Construction Cost Index, which historically has increased on average at an annual rate of about 3.5%. So an increase of over 14.5% is unprecedented. So it's sort of significant of the time we're in. The index reflects the labor and material costs, which are impacted currently by tariffs on imported materials such as steel, supply chain delays on materials and equipment, and shortages of skilled labor. Also included in the updated estimate is the additional cost of the mechanical heat pump system and the cost of the pervious paving. And then the cost of the county's parking replacement project has been removed from the estimate. So that is not reflected in the number you see here. Other project soft costs have been impacted as well, mostly due to the one-year delay in getting to the state's approval of the ground lease for the project. The state required the approval before allowing the county to proceed with the construction documents phase. So that's had impacts on lots of elements of the project. But of note, it's estimated that the architectural and engineering, as well as the construction management billing rates, which have increased because of the project completion date having extended out now from June of 2022 to March of 2024. So also, as I mentioned earlier, supply chain delays, those are increasing construction costs and having impacts on the availability of furnishings and equipment. So those costs that you're carrying in your soft costs are also impacted. So overall, Vanner, who has prepared the estimates, believes that the project soft costs have increased to approximately $6.4 million from $5.8 million in June of 2019. So in total, the current total project cost is $31.1 million. So just in summary now, you know, we're still a ways out from bid day, little less than a year. So we're anticipating that, of course, pending state review and approval, that will occur in early June. The total project cost for the jail is $31.1 million. The offsite improvements, so that would be your parking replacement project, is about $300,000. And then with your funding, $25 million of that, it covers, well, you have a reimbursement from the state of $25 million. You have a local cash match, which has increased to almost $2.8 million. And so we predict or project that the project shortfall is about $3.6 million. And then just as I mentioned, your match has grown over time. This slide just shows you how that has occurred as a reminder. So your initial match of a little over $1 million, you increased that match in April of 2018 by $1 million. There was another increase in fiscal year 19-20 of $500,000. Excuse me. And in fiscal year 2021, another addition of $250,000. That was to provide for the cost, the cost increase for the all-electric heat pump system. So your local cash match currently stands at a little over almost $2.8 million. And then just as a reminder, in July of 2019, you established a separate capital project for the offsite improvements for your jail replacement. I'm sorry, your parking replacement, but that is coming out of the existing funds budgeted for the jail project. So out of that, the match funds, and that is the $300,000 amount you see there. So that concludes my presentation, and I'm happy to take questions.
Supervisor Williams.
The 31 million estimate, if you were to phrase that as a range, best case, worst case, what would you tell us?
Well, it's hard to, I mean, you know, in terms of, I guess, bracketing that, it's really hard to say. I mean, we're in such a volatile time right now. It's very hard to say really what the upper end is, but it seems that right now things are a little more stable. You know, so if we see additional cost increase, maybe not as significant as it has been over the past year and a half.
Would you be as surprised as I would be if we can pull it off for 31?
Yeah, I guess I would be at this point.
Yeah. So if the board has to consider how much to set aside each year to cover the difference, what your guess will be better than mine. I mean, I see the 2.7 now. What's a safe, you know, semi-conservative? We want to have enough.
You might just bring that up to about 4 million.
Okay. That's helpful.
Supervisor McGrory.
So there presently exists in the county yard where this facility is going to go. There's on the south end, there's storage facilities for several different departments. What's going to become of those? Because I understand that they're going to be removed, and how will they be replaced?
You're speaking of the sheds that are just south of that
Yes.
proposed site. Those are proposed to remain. So, you know, any future construction, you know, or removal of those sheds, I'm not aware of. But at this point, there's no plan to remove them as part of the project. There's adequate room there for the building and for the site circulation, vehicular circulation around it, even with the sheds in place remaining.
Supervisor Hashak.
Thank you, Chair Jurdy. Eric, that, you know, the extra parking area that's over near Low Gap, and that I know that there had been talk about putting solar panels over that parking lot, and the board just committed $2 million to putting solar panels on our public facilities, county owned. And so I was wondering if that would be outside of this budget, right? But it could still be incorporated into the project.
Well, so at this point, the project is defined by the boundary that the state, you know, so the ground lease for the project. So anything outside of that boundary would be, so it would not be part of the jail project. You could perhaps fund it as part of your parking replacement project, which is now separate from the jail improvement project.
Oh, okay. And I guess this is a question for the CEO, Angelo, is if we're trying to get $4 million to finish off this project, what is the best way to go about doing it?
Through the chair, through Chair Jurdy, Supervisor Hashak, I think that at this point, the board would have to look at all their funding streams and see what's available. So you could approve certainly moving forward with this budget. I honestly, when this project was started, I don't know if everyone knows this, but Lake County returned the money to the state because they did not think they could build the jail for 25 million. I think that while the costs have gone up, certainly much more so than we would like or that we thought, you know, I don't know that there was any thinking that 25 million would actually do it. So we know that we have a reserve account if we really needed to tap the reserves for this building. And certainly any fund balance that we would have may be applicable as well. So that really will be a decision of this board. You tell us, one, you approve the increase, and then we would come back with options. I do not think that there's any additional grant money or outside money, but I could be wrong. So we would have to check on that. But my guess is this would be all county money. Certainly a match would be an increase in the match. I hope I answered your question, but my answer for you today is I can't tell you exactly where additional funding would come from.
CEO Angelo, it does seem like in part the way we have funded capital projects like this was by taking a look at first quarter budget or mid-year budget where we had the closeout from the previous fiscal year. And at least in recent years, the counties had more money came in than was conservatively budgeted, less money expended. I don't know if that's going to be the case this year with the budget being closed out this year, but for last year. But if that's the case, then maybe another $1 million here, $2 million there, and next thing you know, you have $4 million.
Yeah, you're right, Chair Journey. I don't want to. We always look at the fund balance as one-time money, even though we have been fortunate where every year we do have a fund balance. So, but that would probably be the first option that we would give to the board, which would be the fund balance. So that's my answer for today. I mean, certainly we would find the money. I mean, we're in this. I can't imagine that there would be any change, and we certainly know that this is needed. So we would definitely find the dollars, and then it would be your decision if that was the option you wanted to take.
Okay, thank you. Supervisor Williams.
Is there anything we could begin liquidating now to pay for part of this project? I don't know, stock bonds, cryptocurrency, maybe Willett's Justice Center?
Well, on the volatility of the building materials, just one example of that is the cost of lumber. And I realize there may not be a tremendous amount of lumber in a building that's principally steel and concrete, like a jail, but it's sort of the go-to product that most contractors look at for building costs. And at the end, like last November, the price was around $600 a 1,000 board feet, and it had peaked this May at around over $1,600 a 1,000 board feet. But since it's come back down to about $600 a 1,000 board feet. So, I mean, I know that's not an apples to apples comparison towards all building materials, but it may indicate that, and that's principally a domestic supply of building materials, as opposed to, like you're saying, most steel these days is imported from China. Concrete's mostly domestic, though. It might be an indication that building materials are sort of stabilizing a little bit and coming back to normal. So I guess I'm looking at the glass half full. Do we have any other comments on this agenda item? Do we have any members of the public who wish to comment on this agenda item?
No, we do not.
You need a motion?
I think that'd be appropriate.
Move the recommended action.
Second.
And inherently in that is to ask staff to find $4 million from somewhere.
Okay, we've got a motion and a second. Can we have roll call?
Supervisor McGorty?
Yes.
Supervisor Hashak?
Yes.
Supervisor Williams?
Yes.
Supervisor Mulhern?
Yes.
And Chair Jurdy?
Yes.
The motion carries unanimously.
All right. We have one or two items left on the agenda. I think at this point, I'm looking at County Council. In the morning session, we were looking for just a little supplemental information to include into a motion on the extra help hiring of the former auditor. for the acting auditor. Do you have some additional language for the board?
Yes, Mr. Chair. So my staff worked with the acting auditor to reach some alternative language. So what we have is an alternative recommended action: approve the extra help appointment of Lloyd Weer to fulfill critically needed duties with the scope of work including the single audit, the preparation and issuance of the annual financial report, consultation for the major upgrade of the Enterprise Finance Program Munis, and training of staff in additional aspects of the preparation of their annual cost allocation plan, all of which will occur during the 180 days following his retirement, with a requested limit of $12,000.
I move that we accept that language.
Second.
We've got a motion and a second. I'm just going to go ahead.
I have a question. I'd still like to know what the arrangement has been. I heard our previous auditor has been volunteering for us, and then I heard he wasn't. Has he been? Does he have our email account? Does he have keys? What is the situation?
Chair Jurdy, if you'd like me to answer that to the best of my ability, I will.
Go ahead.
Okay, so the normal process when somebody either retires, quits, leaves the county is that the day that they leave is the last day that they have access to the county email system, any files within the county system, keys to the building, whatever. It is my understanding that Auditor Weer did not turn in any keys and that he still had access to our system. So I also know that I don't know that he had the time to actually fill out the paperwork to be a volunteer. So I can't tell you what the status of our retired auditor was over the last couple weeks or whenever it was that Mr. Weer retired. So I think the person who can tell you is either Mr. Weer himself or our assistant auditor, Shamise Cubison. And if our chief counsel knows, maybe he can say. But I know that in checking with human resources, with information technology, none of those steps were taken.
Okay, we've got a motion. I do want to confirm, I believe earlier we asked for public comment. I just want to confirm that we had already asked for public comment.
Yes, we did.
Ms. Cubison, I see you're in the meeting. Is there something you would like to add?
I mean, I understand that you're prepared with a motion to make this happen. I'm just incredibly frustrated with how the whole transition in the auditor's office is being handled. If you had an issue with how and when the retired auditor left, that should be between you and him, not me. I'm the one left to hold things together and to endeavor to maintain the critical functions of this office that our office performs. And it feels like my hands are tied behind my back, and apparently I'm in conflict with the board for reasons I don't honestly understand. Not a single board member has contacted me about any concerns about my performance as an employee of the county for the last 13 years, nor as the assistant auditor for the last 3. There were several members of the community that reached out to all of you in support of my appointment, and yet you declined to take any action, largely based on old information and prior issues that the auditor's office had with the DA. I don't know that anyone noted that the legal opinion was obtained to support the DA's position on asset forfeiture funds was obtained by the CEO from a colleague of the CEO. I don't know that anybody noted that the legal opinion actually reaffirmed at the time that travel authorizations were required for travel over $1,000 as defined by board policy to include all costs of travel, and that travel claims have been denied for clearly travel over $1,000 when you added all costs together. Did anybody note that that travel policy was amended to exempt the DA after all of those things occurred, and that all of the issues brought up by the DA were nearly all resolved? It's not always easy to be the one to explain why something is not possible and that the policy would need to change to allow someone to do what they'd like to do. And sometimes that includes the board, but that doesn't mean I wasn't doing my job. It seems that the board is of the opinion that they should be in control of the auditor's office so they can selectively decide when the policy should apply to whom and when, without changing those requirements. So, I'm not sure exactly what the problem is with me, but I have performed my duties and I've been an exemplary employee. But it feels like you're obstructing me at every opportunity. So I'm not quite sure, if this is all about creating the director of finance, and that's really what's happening, then it could have been approached in a much more respectful and honorable manner. I'm getting tired of feeling like I constantly have to defend myself for doing my job, for trying to maintain the services and standards for county departments, schools, and special districts, and the community. The workload on my shoulders and that of some of my staff is unsustainable. It's ironic that yesterday the board has been discussing challenges of finding and retaining employees, talking about employee morale and noting that it would be a good idea to poll employees about working for the county, their satisfaction, and what they need to be able to live and work in this community. You also expressed a desire to work with employees as ambassadors to help encourage people to want to work for the county. And yet nothing about how this transition subsequent to the retirement of the auditor controller has been handled to support those ideas. It's appalling how little support our office has received and how disrespectful this entire process has been. I have been a dedicated employee for more than 13 years. And while you may see me differently because now I work in an elected's office, I am and have been an excellent employee. My staff is incredibly dedicated. Some of us have not taken vacations in the last couple of years and have been working incredible amounts of CTO with no appreciation, respect, or allowance for the toll that's taking. Several are now fearful and angered by how little concern you seem to have for our success and are likely considering other employment. We live in this community. We work with people throughout the organization at all levels as we process every invoice and payment the county makes. We deal with every employee through payroll, and yet the board seems to have no concern for our well-being. What kind of message are you sending to the other county employees and the other prospective employees? I was contacted by no less than 20 employees after the August 31st meeting to express their astonishment about how that item was handled. There are dozens of other county employees watching today, and I've already been contacted by 5. Again, totally appalled at how this morning's session went. I implore you to do the right thing today and to find additional ways to be helpful and supportive rather than obstructionist, as that's not looking out for the county organization, its employees, or your constituents. So I appreciate that you're allowing this to happen, but I would appreciate it if you didn't make it sound like it's a huge favor and that somehow the fact that Lloyd Weer has not been completely cut out of the system is somehow a problem. This item I had asked to bring forward on August 31st. It was pulled at County Council's recommendation and supposed to be scheduled at the next board meeting. It did not get on the next board meeting, as I had requested as part of my request to the CEO's office for support during this transition. So it was not been a good process to turn everything off and deny him access and stop the close of the financial statements entirely until we brought him back on the books. So I'm sorry if that was not appropriate. I was contacted by William on my day off on Friday, the first day I've taken off since Christmas, and we will rectify that. But I would like to keep him on the books, as it is not a good transition to have to turn everything off and turn everything back on. So I would really appreciate it if we receive some support to move forward. I was not aware of the items coming forward on October 26th to discuss the Director of Finance. I would appreciate it if some people would talk to the offices that might be impacted and involved in that change. Thank you.
All right, Supervisor Heshak.
Thank you, Chair Jurdy. So thank you, Jamise, for those comments. When I look at the $12,000, I just put 10, it comes out to about 150 hours at $75 an hour. And if you're saying that Lloyd would be working 10 hours a week, that's 15 weeks of employment for him for the scope of in this transition period. So my question to you is, and if we're looking for a regular full-time employee for your, I guess we're looking for 2, But if we're looking for those, we're trying to hire those positions. Is that going to be sufficient of Lloyd's time to help you transition into performing the duties you need to do?
If I may respond through the chair, my understanding is that he's going to take some time off. So even though I'd like to have him 10 hours a week, I'm sure through the holidays and other desired travel that he already has planned, he won't necessarily be able to work strictly a set 10 hours every week. So I anticipate that it's going to be, probably a couple hours more one week and maybe not at all for 2 or 3 weeks. It's going to depend on the deadlines of those tasks that are happening, when they're due to the state, when they're due to the auditors. It's quite likely that the annual colony audit that would normally be taking place right now and over the next 2 months is likely going to get postponed until January or February, because we're not able to meet the requirements of that outside audit firm, and they're going to need to adjust their audit schedule. So I can't predict exactly how many hours every week. I think that would be unreasonable to expect that I would know that for certain. So, he had already indicated to me, this is not necessarily that he needs to be making money. It's not that he's trying to have a second job. He's worked for the county long enough that he didn't have to pay into the retirement system anymore. He's already put in his time. So I would appreciate it if we would respect the fact that he's willing to come back and assist me during this transition.
Supervisor McGordy.
So, Ms. Cozen, I'm sorry you feel like you're disenfranchised in this discussion, but quite honestly, there really hasn't been a discussion. This is something that is an opportunity with the retirement and with the strategic plan going on. So it's not like anyone's been planning anything behind your back. We're just in the beginnings of trying to figure out what do we do next. And I want to assure you that I am supportive of you, and you noted in my discussion this morning that I said it's pretty routine and certainly in educational institutions to bring people back to help. So I hope that you understand that there's not a monolith against you here, and we are supportive and we do care about you and we care about all of our employees. And I know there's some disappointment on your part, but this is an opportunity for us to pause and not do business as usual. And that's what really this is about. No decisions have been made yet. I just wanted to express that so you understand.
I appreciate that, Supervisor McGordy. Unfortunately, I beg to differ. There are no tasks in this office that can afford to pause during this transition and during this discussion. I understand that perhaps that's the reason why I was not given the appointment, but the appointment would have allowed me to carry out the duties and might have been allowed me to attract some employees to this office. But right now it's in a state of flux and transition and very difficult to encourage people to want to work in an office that appears to be possibly in some type of transition that nobody knows where they're going to end up. But the tasks that this office have to perform can't pause. We can't stop the level of work and the amount of work that we're trying to accomplish with the property tax system being implemented and trying to get tax bills out literally over the next 2 weeks, along with a huge finance system upgrade. Those tasks can't afford to be paused. They need to be achieved or there will be some consequences to the organization.
Okay, I think that concludes comment. Can we have a roll call?
Supervisor Mulhern?
Yes.
Supervisor Hashak?
Yes.
Supervisor McGordy? Supervisor
Yes.
McGordy? Chair Jurdy?
No.
And Supervisor Williams?
No.
The motion carries with Supervisors Jurdy and Williams dissenting.
Okay, so I think we may have one more item on the agenda. We were going to go back to legislative update.
I had made the announcement, sorry, this is Atlas Pearson, Deputy Clerk of the Board. Earlier today, we made an announcement that Judy Morris would be providing her ledge update at the next meeting.
Okay, thanks. I guess it just leaves, are there any supervisor reports at this time? Supervisor Mulhern?
Thank you, Mr. Chair. I do provide my report in writing each week on my website, but I did want to mention that the Behavioral Health Advisory Board had its public meeting for the MHSA 3-year plan, and that is available on the website, the county website, under the BHAB meetings. If you would like to review how that plan is going, we're in year 1 of a 3-year plan.
Thank you for that. Any other reports at this time? Okay. Well, with that, we are adjourned at 4:31.